It looks like we have a robust number of testifiers and a lot of great bills to hear. To help facilitate today's proceedings, I would like to ask a few favors. One, if you can make sure to keep yourself muted until you're called upon, and once called upon, if you can unmute yourself, that would be very helpful. Two, if you can also change your name in Zoom to what you have submitted testimony under, that will help us spotlight you and locate you faster, also helping to expedite today's proceedings. Additionally, please note that there is a 2-minute time limit imposed in the CPC committee so that we can get through a lot of these important bills. As we barrel toward Thursday's deadline, we do need to keep a lot of these bills moving if they are to continue on in the legislative process. So at about 2 minutes, I will ask you to start to summarize your testimony if you can. And then lastly, if we can all make sure to extend each other the aloha spirit, which is what I think our state is famous for, and helps to differentiate us from much of what is going on in DC, that would be greatly appreciated and help also, I think, in preserving civil discourse here in the CPC committee. With that, I'd like to take up our first measure, HB 1432. And if this is your first time participating in the legislative process, I do want to welcome you. I also want to note that after each bill and all the testifiers are through, and I think some folks are unmuted. So if you're not muted at present, if you can mute yourself, we can hear a little bit of feedback. Then it'll be a time for our legislative members to ask questions if they have questions on the bill. So that's kind of how we'll take things up. HB 1432, relating to concessions on public property. This increases the term of a concession from 15 to 25 years and removes the requirement that certain concessions can only be awarded to nonprofit organizations. It provides the Director of Parks and Recreation of respective counties in their sole discretion to avoid vagueness in the present law should make certain decisions and designations, and it exempts from the bidding process of Chapter 102 concessions on public property whose operations provide historical and cultural information, goods and services within the state. We have our first testifier, the City and County of Honolulu Department of Enterprise Services.
Aloha, Chair Johansson, Vice Chair Kitagawa. Thank you for the opportunity to speak in front of the committee today. My name is Jerry Papillo, Director of Department of Enterprise Services. We stand on our written testimony, and if I could just add a little bit of information. Yeah, the length of the concession contracts from 15 to 25, that really would allow for substantial capital improvements from some of our concession or potential concessionaires. Some of the properties and premises do need some work to be put into it. So that's a great opportunity for potential concessionaires to come in and build out the space. The length of time in order to amortize those investments needs to be more than the 15 to 25. I think everyone's aware of escalating construction costs and also just attracting longer term concessions really enables for some creative thinking on the types of concessions to come into some of our facilities. That term of 25 years really does give them a more suitable duration. And also it's interesting to have some of these concessionaires be innovative in their approach. We'd like them to be evaluated not just on a highest bid, but also the depth and creativity of their overall business plans. So again, thank you for the opportunity to be here today, and happy to answer any questions. Thank you.
Thank you very much, Director. Members, please note we also have late testimony in opposition from someone indicating that they would not be present to testify. Is there anyone else who's submitted testimony on HB 1432 that I have not called who would like to testify at this time? Okay, seeing no further testifiers, members, any questions on HB 1432? Okay, seeing no questions then from our legislative members on HB 1432, we will proceed then to our next agenda item, HB 1434. This is relating to the counties. This authorizes counties after adoption of an ordinance to sell private property after all notices, orders, and appeal proceedings are exhausted, and to use those revenues to pay unpaid civil fines related to that property. On HB 1432, we have our first testifier, the Department of of Planning and Permitting, Director Uchida.
Hi, Representative Johansson and Vice Chair Kitagawa. I appreciate you guys taking that bill up this time. It's a very important bill for our administration. We have a lot of pending cases where we're imposing civil fines for various land use violations. And a number of them, the violations keep recurring and we keep serving them. The only relief we have right now is to go to our corporation council and then go to a judicial foreclosure proceeding. But as you can probably imagine, corp council is understaffed and overwhelmed right now. So a lot of our cases fall kind of to the wayside. The counties presently have non-judicial foreclosure powers in cases dealing with delinquent real property taxes. So we just want to be able to do the same thing for outstanding civil fine because we can't seem to get a lot of these people's attention. A lot of the houses in some of the neighborhoods turn out to be basically public nuisances, attracting all kind of different things when we can't get the property cleared on time. We have an active violation out in Haula where somebody's filling in wetlands. No matter how many violations we set them for, they don't stop the work. So we need a little bit stronger enforcement on our side to make people comply with the land use ordinances. Thank you for your time. We stand on our testimony in strong support of this bill.
Thank you very much, Director. We also have testimony from Councilmember Brandon Elefante in support.
Thank you. Thank you, Chair Johansson, Vice Chair Kitagawa, members of the CPC House Committee. My name is Brandon Elefante. I'm a current council member and also chair of the Zoning and Planning Committee for the City and County of Honolulu. I echo the sentiments shared by Director Uchida. I stand on my written testimony. What I will also highlight is that in our communities and communities that some of the members you represent, we do have some of these nuisance properties. The city would exhaust all options for notice of violations, notice of order, for coming to the point of looking at a judicial foreclosure. So this would just give us another tool in our toolbox at the county level to look at enforcement so that we can make sure that the community and residents and their concerns are addressed and working with the various respective owners of the property. I'll also share one other thing is sometimes there's some challenges when homes go into foreclosure, there's no next of kin. And so that becomes a problem with banks taking over property and basically serving the appropriate owners for that property. Again, stand in strong support of House Bill 1434. Thank you, Mr. Chairman.
Thank you very much, Council Member. Members, please note that we also have other testimonies proffered by Honolulu City Council members, but they have not indicated that they would be present. However, I would like to ask if there's anyone else who has submitted testimony on HB 1434 who would like to testify at this time. Okay, seeing no further testifiers, members, any questions on HB 1434?
Mr. Chairman.
Representative Har.
Thank you, Mr. Chairman. Director Uchida.
Yes, ma'am.
Good afternoon, Director Uchida. Thank you for being here and thank you for testifying. Could you just clarify for the edification of myself, the notice of violation and the notice of order? So in terms of the process, how long does someone have to follow a notice of violation after, whether it's the homeowner, whoever the violator is, how much time do they have to cure that notice of violation?
Well, it depends on the violation, but we try to work with homeowners. When we set the notice of violation, it's for a particular violation. If our inspectors see that they're taking steps to correct the violation, like making repairs, or they come in for building permit for some kind of work that wasn't permitted properly, then we'll suspend the notice of violation until they go through the permit process. If they get the permit and cure the violation, then the notice of violation goes away.
So are there some blatant actors? Excuse me, I didn't mean to interrupt. Go ahead. Please go ahead.
The notice of order is issued if we see no movement by the property owner to correct the violation.
So they're not trying to cure the violation. They're
Right.
just in blatant disregard. And
Right.
how much time period is that usually generally before the notice of order is issued after the notice of violation?
It varies depending on the violation. For some minor stuff, it's pretty quick. If we don't see active movement quickly, then we send them with the notice of order. And some of the more complicated ones, like they got to get an architect involved to draw plans or something, we kind of work with the landowner to try and get them to conform. That's the whole point of this thing. But we do have the egregious violators who simply ignore everything and just keep doing the work illegally.
Okay, understood. Okay, thank you very much, Director. Thank you, Mr. Chairman.
Thank you, Representative Har. Members, any other questions on HB 1434? Okay, seeing no further questions, then we'll move on to our next agenda item, HB 1568. This is relating to agriculture. HB 1568 changes the law requiring all state departments to ensure that a certain percentage of food purchased consists of fresh local agricultural products or local value-added processed agricultural or food products to apply only to DOE, DOH, PSD, Department of Defense, and the UH system. This requires each of those departments in the UH system to report to the legislature on its progress toward meeting these benchmarks and clarifies the information to be reported. On HB 1568, we have our first testifier, the Department of Health, offering comments. Anyone from the Department of Health for HB 1568? Okay, members, please note their comments. Next, we have Micah Munekata from Ulupono Initiative in support.
Good afternoon, Chair, Vice Chair, members of the committee. Ulupono would like to stand on its testimony in support of this measure. Thank you.
Thank you, Micah. Next, we have Brian Miyamoto with the Hawaii Farm Bureau in support.
Good afternoon, Chair Johansson, Vice Chair Kitty, all members of the committee. Brian Miyamoto here on behalf of the Hawaii Farm Bureau. We'll stand on our written testimony in support.
Thank you very much, Brian. We also have Jan Gouveia with the University of Hawaii offering comments.
Good afternoon, Chair, Vice Chair, members of the committee. The University of Hawaii stands on our written testimony providing comments. Thank you.
Thank you very much, Jan. Members, please note we also have late testimony from the Department of Agriculture offering comments. Department of Agriculture, Morris Ata, offering comments.
Good afternoon.
Oh, sorry about that. Excuse me.
Oh, no, we're just going to stand on our testimony, just offering comments. Thank you.
Thank you very much, Deputy Director. Members, please note that that's the extent of our testifiers who have submitted testimony and indicated that they would be testifying virtually today. Please also note that there are supportive testimonies, oppositional testimonies, and additional comments on HB 1568. Is there anyone else who has submitted testimony on HB 1568 whom I didn't call who would like to testify at this time? Okay, seeing no further testifiers, members, any questions on HB 1568? Representative Onishi.
Thank you, Chair. I guess since I don't see testimony from Department of Ag, right? There is not.
They offered comments, but
Oh,
they're
there
late.
is. Is there anybody here?
Morris was here. There he is. He's on your screen, Morris.
Morris is on.
Yes, I'm on.
Oh, okay. Morris. So, the university is in their testimony is saying that most of their vendors are contracted. So how does the department feel that this measure could be applied to the university?
I don't think we've really looked at that, and I would defer to the university and their processes, because I'm not real clear on their process for, purchasing food products.
So, okay. Farm Bureau. Brian, how would this be implemented to contract suppliers of food within a department or agency? Brian Miyamoto, Farm Bureau.
Yes, Representative, I'm sorry, sorry, I'm on another hearing also. Put that one up. Could you repeat the question, Representative?
So how would you think this would apply to vendors contracted by a department or agency to provide the food service?
I'm not sure I'm following you. The requirement would
Well-
still be there that they need to have the vendors or purchase from vendors who supply them local produce.
So your contention would be that would have to be in the written into the procurement.
Not sure if it needs to be written in procurement. I think that the requirement would be on the state agencies to find those vendors that do have the option of the local produce and purchase from those specific vendors.
Well, I'm not talking about the actual produce. I'm talking about the people who provide the food. For example, Starbucks or Subway, or those people who are concessionaires within the university system or any other system.
Could you repeat that? I'm sorry, Representative. I'm not. So you're talking about those vendors on campus that provide food service?
And they're contracted by the university.
I would assume that it would have to be for those vendors just because of this requirement.
So they would have to, the university would have to write that into their procurement process.
I would defer to the university, but I believe so. Again, with the requirement of a certain percentage of food that needs to be local.
Okay. Chair, if I might,
Please go ahead, Representative.
university, Jan, you're testifying that this may become problematic in terms of your concessionaires at the university system, within university system. How would you think this measure would be applied within the university system to be able to comply?
Thank you, Representative. Yes, I mean, we interpret this measure to be a fairly black and white type of rule. You know, it's strict compliance. There's not a lot of leeway or exceptions granted in the event certain thresholds cannot be met. And so as a result, you know, very simplistically, this is something we would probably have to write into all of our concession agreements, which again, because of the strictness of the language, we anticipate it would, you know, ultimately raise costs to the consumer, who will be primarily our students. And as we expressed in our testimony, you know, we already have some language for local product preference in our Sodexo contract on our main Manoa campus. And, you know, at best, they only hit 30% when, given the whole year-round season that we need to provide, you know, food service to our campus. And so I think we already have some real examples of what the impact would be if a strict threshold of, let's say, 50% is imposed without any representation or any exceptions or recognition that there might be instances where our concessionaires are not able to acquire the local products.
Okay, thank you for that clarification. Thank you.
Thank you.
Thank you, Representative. Representative Har, did you have a question?
Thank you, Mr. Chairman. Ms. Govea, thank you very much for being here and thank you for your testimony. I read your written testimony, and I think in addition to some of the concerns raised by Chair Onishi, one of the questions that I think is, you know, we talk about well-intended bills, but unintended consequences are always the concern. And one of my concerns was you talked about the fact that the end consumer, namely the students, would be passed on these higher costs. So I'm just trying to understand the contracting process and why you guys would, I mean, people would just say, well, why doesn't the university eat the cost? And why do you have to pass it on to the, you know, to the consumer, to the students? I mean, you know, why is that? Sure.
So this is a concession agreement. We don't purchase food service and then turn around and sell it to the students, right? Where we offer a concession space. And
Contract
so-
that out to another vendor.
Yep,
So that's
yep.
okay. So it's
So
the
start-
vendor. I
Yes.
see. So they would ultimately be making that decision, not the university.
Correct.
Okay, got it. And then again, getting back to this issue of having a locally preferred, food source, and you have that kind of locally first policy. But to date, you folks have only seen 30% has been. But do you think if there was a mandate? I mean, but because you talk about in your written testimony that you're not sure if 50% is in fact achievable. But I want to play devil's advocate. Well, what if it was a mandate? Then, wouldn't it have to be achievable? Right now, it's just locally first. So maybe that's why you guys haven't reached the 50% or the higher benchmark?
Yeah, I understand where you're coming from. And quite honestly, we have not evaluated it at length. There has been a task group formed, I believe, that's been looking at this bigger picture. And so because of our participation in the task force, we started gathering some data, but right at this moment in time, I don't have all the details. We're still kind of evaluating everything. But from what I understand, the primary reason for not getting above 30%, and that's at the peak,
Okay.
it is a supply issue.
Yeah.
It's not for, we don't need a greater incentive. We already have it in our contracts that require it to be a preference. But it is my understanding that there's a supply issue, or that there could be a supply issue.
Okay, one last question then regarding these vendor concession agreements that you have. So these are in fact procured. I'm going to assume they go through the procurement process.
Right.
Okay, I see. So that's why Representative Onishi was talking about you'd have to redo the entire RFP, et cetera. Okay, got it. Thank you so much, Ms. Govea. Thank you very much, Mr. Chairman.
Thank
Thank
you.
you, Representative Har. Members, any additional questions on HB 1568? Okay, seeing no further questions, then we will move on to our next agenda item, HB 1830. This is relating to state self-insurance against property and casualty risks. It establishes a state self-insurance against property and casualty risks special fund to be administered by the comptroller to provide the state with self-insurance against the state's property and casualty risks. On HB 1830, our first testifier, the Department of Accounting and General Services, with comments.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, members of the committee, Kurt Otugu, State Comptroller. Department of Accounting and General Services stands on its written testimony. We agree with the intent of the measure, but we provided comments with regard to the approach of this. And just to comment that we really appreciate the support that the legislature has given thus far for this endeavor. Insurance cost is very costly, and we continue to see it escalate. The world events that occur, whether it's natural and what have you, do affect our premiums here in the state of Hawaii, even though we don't have that same kind of activity or loss. And so the state is seriously needing to review its policy on how we take care of our insurance for property, liability, cyber security, as well as crime. So my risk manager, Tracy Kitagawa, and I are available to answer any questions. Thank you for this opportunity.
Thank you very much, Director. Members, please note we also have comments submitted from the Department of Budget and Finance. That's the extent of testifiers who provided testimony on HB 1830. Is there anyone else wishing to testify on HB 1830? Okay, seeing no further testifiers, members, any questions on HB 1830? Representative Hashem.
Next, please. Thank you, Chair. Kurt, Director, are you on?
Yes, sir.
How much do we pay now a year for our insurance, property and casualty?
Currently, we pay about 19 million. Just to give you that perspective, in fiscal year 2019, the premiums were about 12.2 million. I'm sorry, even less than that. But since that time, we've seen increases, about 12 million. Fiscal year 20 was 15, fiscal year 21 was 19.2, and we're expecting another 21 million and even higher than that. So it's been escalating fairly quickly. I would say that the property insurance has really escalated. We all know that the issues that the world has experienced with cyber insurance, and so cyber liability insurance is something that we absolutely will go self-insured this coming year, because it just doesn't make sense with the premium cost versus the coverage.
Okay, thank you. Can I continue on to the question, please?
Represent.
Director, what is the, don't we have caps on that too? Like I remember before there was a $200 million cap and 25 million per building. Is it still the same policy?
Yes, sir. You're absolutely correct. So in property insurance, we have a $200 million per occurrence cap. On excess liability, we had a $7.5 million cap, but we have certain premiums that we have to pay on that. Crime was about 10 million. Cyber was 50 million, just to give you an example. And what we're looking at now is the carriers are willing to provide only 5 million in that kind of insurance, but so a drop of 45 million, but we got to pay 650,000 for that, but we have to cover so much of it. So certain things just don't make financial sense.
I see. Who is that, just to one company, or is it spread amongst multiple companies?
It's spread across multiple companies, and I'll ask if you want the details. We can have Tracy Kitaoka explain that to you. We use Marsh as our broker, but in there it's like a participation. So what Marsh will do is find carriers that will take a portion of the amount of the coverage. And so in the case of cyber, we had 5 companies that provided 10 million each. Same thing occurs in property insurance. We have different carriers that take a different part of that amount to cover the entire amount for the state.
Okay, thank you very much. Thank you, Chair.
Thank you, Representative. Members, any additional questions on HB 1830? Okay, seeing no further questions on HB 1830, then we'll move on to our next agenda item, HB 1908, relating to procurement. This allows bidders to clarify or correct immaterial or technical information required as part of a bid submission for up to 24 hours after the bid submission deadline, in addition to the time for correction or withdrawal of an inadvertently erroneous bids before or after the award permitted by rules adopted by the Procurement Policy Board. It requires that bids for construction be open no sooner than 24 hours after the deadline for the submission of bids. It defines immaterial or technical information. And it would be a 2-year pilot that repeals in June of 2024. On HB 1908, we have our first testifier, Department of Accounting and General Services. In opposition.
Thank you, Chair, Vice Chairs, members of the committee, Colonel Tuguro, State Comptroller. The Department of Accounting and General Services stand on this written testimony in opposition of this bill, and happy to answer questions. Thank you.
Thank you very much, Comptroller. We also have the State Procurement Office, Bonnie Kahakui, offering comments.
Good afternoon, Chair, Vice Chair, members of the committee. Bonnie Kahakui for the State Procurement Office. We stand on a written testimony in opposition to this bill. Thank you.
I'm sorry, in opposition, excuse me.
Yes.
Thank you, Bonnie. We also have Tim Lyons with the Subcontractors Association of Hawaii in support.
Good afternoon, Mr. Chairman, Vice Chair. The Subcontractors Association, which is composed of 9 different subcontracting groups, can support this bill. As you're probably no doubt aware, this has been an issue on both sides for many years, particularly with general contractors saying they don't have enough time to check their bids. We're not sure we subscribe to that theory because we think they ought to be sure it is. However, in the spirit of cooperation, we can support the intent We would also respectfully ask the committee, if you're going to pass the bill out, to honor the 2-year sunset clause that was inserted by the last committee. This is a really important financial health issue for subcontractors, and we want to be sure if it passes that it works, but if it doesn't work, we want the opportunity to come back. So we would consider a 2-year trial run in an effort to try to help resolve this issue. Thank you.
Thank you very much, Tim. We also have the Contractors License Board offering comments. Hi, Candice.
Hello, Chair Johansson. I'm sorry, but my board member Neil Arita is not able to attend, but the board stands on its written testimony submitting our comments that allowing a subcontractor with a forfeited license to bid is in conflict with our Reichardt Chapter 444 for contractors. And I can answer any questions. Thank you.
Thank you very much, Candice. We also have the General Contractors Association of Hawaii and Sport, Ryan Sakuda.
Good afternoon, Chair Johansson. GCA would just like to add some additional comments that is not in our written testimony. So the purpose of the bill is to attempt to reduce the number of bid protests regarding subcontractor listing. One agency described the scene at bid opening as general contractors will examine the subcontractor listings of other bidders who submitted lower price bids, and they'll photograph these listings. They will then go to the professional vocational licensing website and check if the licensing information for those subs with the hope of finding technical flaws to protest on. We're hopeful that this measure will address this issue. As you have heard, the GCA and Subcontractors Association have finally compromised on a model that has the potential to reduce these protests. We have also been in contact with the representative of the Labor Management Cooperation Funds of the painters, tapers, glaziers, and carpet and soft tile layers to address their concerns as well. And as a result, the GCA will not oppose their suggested amendments. We do note that we are unsure if the suggested amendment to move the language to subsection 103D-302G instead, but we'll leave that up to the drafting agencies to determine as they are best suited to make that call. So this is basically looking at California's procurement code as a model, and this is what they've implemented. This is also a recommendation that was given to the State Procurement Office by an independent study. So for these reasons, we hope that the committee moves this measure and allows the parties to continue their good faith efforts to help address the longstanding sublist issues. Thanks.
Thank you very much, Ryan. We also have Jeffrey Masatugu with the Painters, Tapers, Glazers, and Carpet Layers Management Fund in opposition.
Good afternoon, Chair, Vice Chair, members. I'm Jeff Masatsugu, and I represent 4 labor management cooperation funds, the Painters, Tapers, Glazers, and Floor Layers. So these are jointly administered funds between the unions of those 4 trades and their signatory contractors. That is the contractors who have signed collective bargaining agreements with those unions. Chair, we're opposed to this measure. We think that it's really not necessary because what this bill is trying to do is already possible under existing law and the administrative rules. I think substantively, the only difference between the existing law and rules is that this measure would take away any discretion on the part of a procurement officer to decide whether or not an exemption is appropriate. We have significant concerns about this measure. However, if the committee inclined to move this along, we would ask at a minimum that the committee consider deleting section 1 of the measure, which we strongly disagree with, and also moving the language, the operative language in this bill into HRS section 103D-302G as in golf. And the reason for that is this, we think that if you create 2 separate sections under the HRS whereby you can have corrections to a bid after it's already been submitted or before it's even been submitted, all that's going to do is cause confusion. And if you have 2 separate sections that basically say the same thing, we think what's inevitably going to happen is a lawsuit challenging which section is appropriate. So we think that this measure could actually increase the number of bid protests you have as far as insofar as changes, ministerial changes are concerned. So at the very least, we'd ask the committee to consider those two amendments. Thank you.
Thank you very much, Jeff. Members, please note we also have late testimony from the Department of Transportation. Not here. Does not appear the Department of Transportation is here. They offered comments. Do we have? We also have late testimony from Stephanie Sakamoto in support.
Good afternoon, Chair, members of the committee. Stephanie Sakamoto on behalf of BIA Hawaii will stand on our testimony in support of the intent of this measure. Thank you.
Thank you very much, Stephanie. Members, please note that on HB 1908, we have other testimony in opposition and support. Is there anyone else wishing to testify on HB 1908? Okay, seeing no further testifiers, members, any questions on HB 1908?
Mr. Chairman?
Representative Har.
Thank you, Mr. Chairman. Can I please have the painting industry of Hawaii, the Hawaii tapers, glaziers, and carpet, linoleum, soft tile? Mr. Matsutsugu.
Good afternoon.
Yeah, Mr. Matsutsugu, thank you for being here and for testifying. You know, your testimony is, and I'm sure you have not seen it, but your testimony is pretty much mirrors the testimony of the city and county of Honolulu, which essentially states that this is unnecessary because there already is this recourse. And so could you, and again, I'm not familiar enough with the section 103, with HRS 103, but again, I'm looking at the city and county's testimony and yours, and it's remarkably similar with respect to already having this in statute. Could you just clarify for us what exactly, how in the procurement code this is actually cured? This is that people are, or I should say, you know, when bids are given, procurement process is already allowed.
Yes, thank you, Rep. Hart. So under 103D, section 302G, it's actually in my written testimony, but the statute says correction or withdrawal of inadvertently erroneous bids before or after award, or cancellation of invitations for bids, awards, or contract based on such bid mistakes shall be permitted in accordance with rules adopted by the policy board. So the statute mandates the allowance of corrections, certain types of corrections, and you know, there are more restrictions that are codified in the administrative rules also. But essentially, like I said, the difference between this measure and what is already existing in the admin rules is that there will be no discretion on the part of the procurement officer whether or not to allow the correction. It's just going to be, it's going to be more like a matter, it's going to be allowed as a matter of course.
Okay, so you've heard the testimony though from GCA and BIA, and you know, so let me just play devil's advocate for a minute and say, well, again, if this bill were to go through, it essentially gives only 24 hours. Isn't that a good thing? I mean, that's, you know, can you hear me? So that's, you know, this bill would actually allow bidders to clarify up to 24 hours after the bid deadline. So by playing devil's advocate, I mean, this actually gives a specific time period versus just kind of saying the correction can be made and then arguably could prolong the bid period or the appeal period. So I guess I'm just trying to, you heard the testimony of GCA and BIA. How do we overcome that? Because I agree with you, it's in statute, but again, I'm not saying, I don't necessarily see, everybody seems to be in support of the intent of this bill, but I guess from a procedural standpoint, it might be a little bit more nuanced than we understand from a procurement standpoint.
Yeah, you know, one of the things the prior committee did was amend the language that would go under 302 subsection B, as in Bravo.
Okay.
We think that that's not going to solve the problem because you're still going to have two separate sections in the statutes allowing corrections. So if there is to be a change, the better way to do it, we think, would be to put all of the language detailing how you go about making that correction. You put subsection G.
Okay.
My understanding is that the GSA wants to codify certain practices that are contained within the admin code into statute. And again, I think the best way to do that is not by having two separate sections under the HRS. It's by putting that language. If you want to clarify the admin rules, and put it in the section where it belongs, which is subsection G.
Got it. Okay. Thank you very much, Mr. Masasaku.
Thank you. Thank you, Rep.
Thank you, Representative Har. Members, any additional questions on HB 1908?
Sure. I have a
Representative
question.
Onishi.
This is for Ryan Sakuda with the General Contractors Association.
Hey, Rep.
Hi. I have, I guess, some concerns about the Contractors Licensing Board and the General Contractors Association being, I guess, somewhat at odds in this bill.
Yeah, you know, we would not oppose language if the committee wanted to remove that. Basically, this stemmed from an issue where there was a building, I want to say it was like the Kamamalu building or something like that, where the four lowest bidders wrote the same subcontractor down, and his license was either in the process of moving companies or he was in the process of getting a license renewed. And those four lowest bids got thrown out. It was awarded to actually one of my members, who was the fifth lowest bidder, at an increased cost of $3.3 million to the state. And that's just something that they thought was technical, but if it goes against what's currently allowed, we're not opposed to this, to just deleting that provision.
Okay, but there has been testimony that says that changes are allowable under current statute.
Yeah, so what they're referring to is if you look at the admin rules, so it says you're allowed to make changes pursuant to the admin rules. The admin rules allows you to petition the procurement officer to see if they will allow it. So in the independent study that was given to the state procurement office, I can read, it says, the state's protest-related risk could be greatly mitigated by adopting a variation and expansion of California's post-bid correction process outlined in its subcontractor disclosure statute. California statute contemplates innocuous errors and specifically builds in a controlled correction period where typos can be corrected after bid opening. So this is just to model it, because what happens is people will then look at the subcontractor list, and before people will even have the chance to petition, they'll file a bid protest, which we think in the spirit and the nature of the law is to just allow these typos to be made. There shouldn't be a discretion involved in it. Just let it be black and white, give them 24 hours, fix it, and hopefully reduce the number of protests.
Okay, Chair, one more question.
Please go ahead, Representative.
So the state procurement office.
Good afternoon, Representative.
Yeah, hi, Bonnie. You just heard this testimony by the general contractors in regards to, I guess, the study that was done and the recommendation. Are you in agreement with that recommendation?
No, we are not. So that study that was done was actually, we asked the vendor to compare the Hawaii state statutes and rules and compare it to the federal statute and rules. And the federal rules say there is no subcontractor listing. But it goes on to say, if there were going to be a change, then perhaps the California model would be best. But they did not recommend that this be done. recommendation to avoid protests is to have no subcontractor listing, similar to what the federal government is in alignment with.
Okay, well, to me, that's a technicality because that study indicated no subcontractor list. Which is
That was the
similar to
recommendation.
federal government. So does that mean that the procurement office would be in favor of eliminating the subcontractors listing for contracts, for bids?
We would be in favor of that if that's going to eliminate the protest, or just leave the statute the way it is. Because our position that this bill basically gives the bidders a second and third possible chance, because the bill goes on to say that this 24 hours is in addition to the other time. It says it's in complementary to the other times for other mistakes. So now we're giving them second and third bites of the apple. So in fairness to the vendors who do this correctly, get their bids in on time and accurate, we're allowing them to have a second chance.
Okay, thank you. Thank you, Chair.
Thank you.
Thank you, Representative. Members, any additional questions on HB 1908? I just have a quick one for State Procurement Office, Bonnie.
Yes, sir.
Thank you very much for your testimony. I just was curious, for the administrative rules and the process laid out in your testimony, do you know how often this is utilized at present to make these potential corrections?
I'm sorry, I don't have that information.
Okay.
I don't know,
no
maybe
problem.
if someone from Public Works is on. I don't think so at this time.
Okay, no problem at all. I just was curious. Thank you. Members, any other questions? Okay, seeing none, then we'll move on to our next agenda item, HB 1679. We are leaving the Government Reform Committee and moving on to bills that have been passed to us from the Health, Human Services, and Homelessness Committee. HB 1679 is relating to acupuncture. This makes comprehensive updates to Chapter 436E regarding acupuncture practitioners to reflect modernized scopes of practice, titles, and licensing and renewal requirements, including 30 hours of continuing education per licensing biennium. So this is a pretty big bill attempting to recodify some of the acupuncture statutes that haven't been updated in a long time. First on HB 1679, we have Reichardt with the Board of Acupuncture in support.
Good afternoon, Chair and members of the committee. My name is Reichardt, Executive Officer for the Board of Acupuncture. We'll stand on our written testimony in support with suggested amendments to the continuing education implementation date and a provision to address licensure by reciprocity. Thank you.
Thank you very much, Reichardt. We also have Wai Hao Lo with the Institute of Clinical Acupuncture and Oriental Medicine in support. Go ahead, Dr. Lo. I think you have to unmute yourself.
Okay.
There you go. Now we can hear you.
Okay.
Go ahead.
Thank you, Chair and Vice Chair, and I stand by my testimony and I'm available for question, if any. Thank you.
Thank you very much, Dr. Lo. We also have, well, I guess that's the extent of testifiers who've indicated that they would be present at today's hearing. However, members, we do have numerous testimonies in support and some in opposition for HB 1679. Is there anyone else on HB 1679?
Yes, there is.
Wishing to testify?
I would.
Oh, I'm sorry, Barbara, that's my mistake. We do have your testimony. It's
Hi.
bifurcated. Sorry.
That's okay. Good afternoon.
The Hawaii Acupuncture Association in support. Excuse me.
That's okay. Good afternoon, Honorable Chair Johansson and Vice Chair Kitagawa. and honorable members. And it's good to see Representative Tarnas. I want to thank you for all the help you've given me. Yes, and I'm Dr. Barbara Ota. I'm president of the Hawaii Acupuncture Association. I stand by our testimony and am in support of this bill. Thank you very much. I'm available for questions.
Thank you very much, Dr. Ota. And again, my apologies for that. We also have AccuPlan Hawaii in support, Samantha Prius.
Hi, good afternoon. Are you able to see me?
We are.
Okay.
Good afternoon, Samantha.
Good afternoon, Chair Johansson and Vice Chair Kitagawa and members of the committee. My name is Samantha Price and I'm president of AccuPlan Hawaii. We're an organization of acupuncturists who accept insurance and contract with insurance companies. So we're more focused on the insurance aspect of this update. I did submit written testimony in support, but also wanted to add that it's been 20 years since the scope has been updated. And since then, acupuncture coverage has, or insurance coverage for acupuncture has really expanded and evolved. HMSA, Kaiser, UHA, HMAA, the VA, Medicare, workers' comp and auto all have some varying levels of coverage for acupuncture. So insurance companies can determine coverage and therefore payment of services based on what the scope specifies. The current scope is vague and leaves room for confusion. For example, it's logical and necessary as an acupuncturist to perform an evaluation before treatment, but some companies refuse to pay for the evaluation portion because it's not specified in our scope. So this bill would clarify that and help prevent billing disputes. We also support bringing the Hawaii licensure standards up to national standards. I know some people have concerns about the CEUs, but many of the acupuncturists in Hawaii are also nationally certified by the NCCAOM already, so we have to meet those CEU requirements anyway. And it's just a good practice. Most healthcare professionals have to do CEUs for their licensure, and I think acupuncture should be no different. Mahalo for your time.
Thank you very much, Samantha. Again, members, please note that we have numerous testimonies in support and a few in opposition provided, but not indicating that they would be present to testify virtually. Is there anyone else wishing to testify in HB 1679? Okay, seeing no further testifiers in HB 1679, members, any questions? Representative Tarnas.
Thank you very much, Chair. Question for Barbara Ota. Appreciate your good work on this on behalf of your organization. It seems like this is a long time coming and it will really update your scope of practice.
Yes.
If you could really briefly describe to us the process you've gone through in order to produce what I think is really a comprehensive legislation here in order for us to update your scope of practice.
Well, what we've gone through is looked at national standards, what other states have done, and we looked at our language, current language in this outdated scope. And we compared and saw what was needed. Say, as Samantha Priest said, the insurance, to be an insurance provider for the Veterans Administration is going to be mandatory. They will, to be a certified practitioner on the national level, that means taking continuing education. So all of those criteria make a domino effect. And so we researched it, gone from state to state, see what is mandatory, what is needed, and what is the minimum standards. So what we reached is really a minimum standards for our colleagues in the state. And in the Reciprocity Act, we want to make sure if somebody wants to move to Hawaii and has stayed licensed and up to date in their certifications, they will meet our criteria. So it's all about education, certification, and continuing education. it has been quite a process, and I do thank you for educating me on that.
Well, I appreciate that description for the members of the committee so they can understand the comprehensive process you've been through in order to produce this piece of legislation to update the scope of service for acupuncturists in the state. So I appreciate your good work on that. Thank you very much, Dr. Ota.
Thank you so much. Aloha.
Thank you, Chair. That's all my questions.
Thank you, Representative Tarnas. Members, any additional questions on HB 1679? Okay, seeing no further questions on HB 1679, then we'll move on to HB 1823 relating to health. Maybe if you can mute yourself if you haven't been called on, that'll help us. On HB 1823, this is relating to health, and it authorizes APRNs and physician assistants to practice medical aid in dying in accordance with their scope of practice and prescribing authority. It authorizes APRNs with psychiatric or clinical nurse specializations and physician assistants to provide counseling to qualified patients. It reduces the mandatory waiting period between oral requests from 20 days to 15 days, and it reduces the mandatory waiting period between the initial oral request and the provision of the prescription from 15 days to 10 days if more than 10 business days have passed between the initial oral request and an appraisal of the patient by the attending provider or counseling provider. It waives the mandatory waiting period for qualified patients not expected to survive the mandatory waiting period, and it prohibits the disclosure or discovery of information collected or retained pursuant to incidental or routine communication between the Department of Health and qualified patients and or providers. Simply put, this would allow APRNs and physician assistants to also participate in the state's medical aid in dying program. On HB 1823, we have the Department of Health offering comments.
Good afternoon, Chair, Vice Chair, members of the committee. Lauren Kim, Policy Officer for DOH. We'll stand on our written testimony offering comments, and I will be available for questions. Thank you.
Thank you, Lauren. We also have Leanne Tashima with the Board of Nursing offering comments.
Thank you, Chair Johansson. Vice Chair Kitagawa. Sorry, I was kind of eager and I unmuted myself. We'll stand on our written testimony offering comments only as a respect to advanced practice registered nurses. We don't take a position on any other amendments proposed in the bill. Thank you.
Thank you, Leanne. We also have Laura Reichardt with the Hawaii State Center for Nursing offering comments.
Good afternoon, Chair Johansson, Vice Chair Kitagawa. Like the Board of Nursing, the Center for Nursing stands on our written comments as it relates to Section 2 of this measure. And we're available for any questions. Thank you.
Thank you. We also have, we have Peggy Mirswa with Aloha Care and Support. We do not. Samantha Trad, the Hawaii with Compassion and Choices in support.
Thank you, Honorable Chair Johansson and Vice Chair Kitagawa. I am the Hawaii State Director for Compassion and Choices, and I'll keep my comments brief. I see a lot of people on here to testify today. I just wanted to offer, in addition to our written testimony, that we've been working on implementation of this bill of this law for the last 3 years. We are so grateful for the passage of this law. We've worked with many medical providers, healthcare systems, hospices, many who you will hear from today. And we get calls from patients regularly who are unable to access the law. The people who want to access the law are imminently dying. They are not able to wait through the waiting period oftentimes. And we're seeing now in other states that they're reducing the waiting period. In fact, both Utah and California have a 48-hour waiting period, and Oregon allows the physician to waive the waiting period entirely. This is a safe and trusted practice that has been around for over 20 years, and both advanced practice registered nurses and physician assistants already have within their scope of practice the ability to support patients. So especially with the growing shortage of physicians, we ask you to please pass this bill. Thank you so much for hearing it, and I'll be available for questions.
Thank you very much, Samantha. We also have Dr. Linda Beechnorth with the Hawaii chapter of the American Nurses Association in support. I guess she is not here. Do we have Charles Miller with the Hawaii Permanente Medical Group in support? No, not here also. How about Michelle Cantillo with Hawaii Pacific Health?
Hi, good afternoon, Chair and Vice Chair and the House Committee. I'm a registered nurse, Advanced Care Planner Coordinator for Hawaii Pacific Health, and I do help the patients try to get attending physicians to help them, to support them in this law. I support my written testimony. One thing I wanted to mention in there, I did say we have 15 physicians who are willing to do it in our HPH organization. Medical staff, we have 1,500 people, and that's only 1% of our physicians willing to do it. So the need for APRNs and providers to help support our patients I do recommend that, as well as support the audit. And I'm here for questions. Thank you.
Thank you very much, Michelle. We also have individual testimony from Aubrey Hawk in support.
Thank you, Chair, Vice Chair, and members of the committee. My name is Aubrey Hawk. I live in rural Hawaii, East Hawaii, the Big Island. I'm a community volunteer, and one of the things that I've been doing over the past 3 years is acting as a volunteer patient navigator for rural patients, mostly poor rural patients who just cannot find a provider to help them. These people are in their final days. They're in pain. They're scared. A law that they thought they could access suddenly is not available to them as they try to seek help. Allowing qualified APRNs, that is APRNs with prescriptive authority, who already have all of the capabilities and scope to help patients under this law, allowing them to help would greatly reduce the instance of these people suffering and dying in just the way that they did not want to. In fact, I just spoke to a patient from Maui today, 60-year-old woman with uterine sarcoma. She is terminal prognosis, 3 to 6 months to live. She cannot find anyone on Maui to help her. I now will begin the process of making phone calls and seeking people. We've had doctors who've flown over to Maui to help patients. That's not the way it should be. So I really beg you to please pass and allow APRNs to help their patients with the Our Care, Our Choice Act. Thank you.
Thank you very much, Aubrey. We also have Mary Steiner in support.
Chair, Vice Chair, Mary Steiner speaking. As an individual in strong support of this bill, you have my written testimony. There's nothing more I can add except, please, this is really important to people who are sick and dying. Thank you.
Thank you. We also have Pablo Stewart in support.
Yes. Good afternoon, Chair Johansson and Vice Chair Kitagawa. Thank you for this opportunity. I stand by my submitted testimony. However, we're talking a lot about the use of advanced practice nurses, which I am in support of. However, I would really like to emphasize the time frame, the waiting period. I've been involved in around 20 of these cases, and most of them go somewhat smoothly, and it allows people to take control at the end of their life and to die with dignity in a pain-free manner. However, I've recently had a couple of cases where the person's illness, and let's be clear, these are people who are past any sort of medical intervention. And dying is not an illness, but what we can do is we could help them die with dignity and in a compassionate way. The time frame between first and second request is extraordinarily long. And recently I had a couple sad cases where people die while they're waiting and they're suffering needlessly. So I would strongly encourage the committee to consider shortening the time frame, as well as considering the use of advanced practice nurses. And I'm available for any questions.
Thank you very much, Dr. Stewart. I believe we now have Charles Miller with the Hawaii Permanente Medical Group in support. Charles Miller, are you here?
Can
Oh.
you hear me? Can you
We
hear
can.
me now?
I think your bandwidth might be
Okay.
a little bit low.
Sorry about that. Well, unfortunately I'm in Kona. So my name is Dr. Charles Miller. I am representing the Hawaii Society of Clinical Oncology. We are the largest professional organization representing cancer care professionals, just physicians, but professionals in the state. And I submitted a written testimony, and I stand by that, but I did want to emphasize two things. Number two, said, he and I worked together on these cases. The waiting time is way, way too long. We have data from the State Department of Health, from Kaiser, and from HPH. And the cumulative data shows that over 30% of our patients over the last 3 years have died during the waiting period. I personally have consulted on over 125 patients in the past 3 years, and that's 30% of them that never make it through the waiting period. The only other point I wish to talk to is the neighbor islands are in sore need of having more and we all know the shortage of physicians, and APRNs already take up a lot. Be allowed to do this as well. Thank you for allowing me to testify.
Thank you very much, Dr. Miller.
That's fine.
Next, we have Malachi Grange in support.
Thank you, Chair, Co-Chair, and Committee. My name's Malachi Grange. I'm a retired registered nurse. I've worked in Oregon, where medical aid in dying started 20 years ago, and in Hawaii in end-of-life care. I strongly support this measure. I stand on my comments. The Our Care, Our Choice Act was a huge compassionate step forward for the people of Hawaii who wanted to use medical aid in dying. Compassionate intention and a promise was in the original bill. Unfortunately for some, this promise is not fulfilled. And that's because, as people have said, there's not enough medical providers in Hawaii. And that's across the board. Everyone knows that. It's just not doctors who won't get involved. So that's an important principle to address that, allowing advanced practice nurses, registered nurses, to participate in medical aid in dying addresses this. And they are qualified, they are trained, they are experienced in providing medical aid across the broad spectrum of medical care. So it's getting them involved will help. The other thing is the 20-day waiting period does not work for everyone. Some are sick enough or maybe unexpectedly, they die before that's over. This bill will, reduce it to 15 days and even less if the medical provider deems that their death is imminent. And I can tell you from personal experience that having this option takes away fear and anxiety from all these people who have a terminal prognosis, meet the qualifications, and they're ready. Their family are ready. They have gone through long and intense conversations and prayer about this, and their moral compass now points them that this is the right thing to do. Some have arranged rituals or have people coming from the mainland for their final acts of love. And instead of that happening with their autonomy on how, where, and when to die, it is not happening. And you can imagine the devastation this gives to patients and families on the last day of their life. Thank you very much.
Thank you very much, Malachi. We also have Brian Goodyear in support.
Mahalo, Chair and Vice Chair, representatives. My name is Brian Goodyear. I am a clinical psychologist. I have been performing mental health consultations for patients requesting medical aid in dying for the past 3 years. I've seen over 80 patients during that time. So I think I have a fairly good picture of the situation. I have submitted testimony, written testimony in support of this measure, and I stand by that. I would just like to add a couple of pieces of personal thoughts. Over the course of my career, I have worked with a number of APRNs, and I have consistently found that they are competent professionals and they are well equipped to provide this service. It's within their scope of practice. That just needs to be codified into the law. Regarding the waiting period, I'd like to give an example of a patient that I saw just recently. When I saw her, she's almost 90 years old. Had just received a cancer diagnosis only about a week before I saw her. And I think given her condition, she was at high risk of deteriorating very quickly. And it's for patients like this that the waiting period needs to either be shortened or waived at the attending physician's discretion. Thank you for the opportunity to testify. I'm available for questions if necessary.
Thank you very much, Brian. We also have Lauren Love in support.
Yes, thank you. Can everybody hear me?
We can.
Okay, wonderful. Thank you. I really just want to echo what some of my colleagues have said. I'm a hospice physician on Oahu, and I have had the great honor of helping, I don't know, maybe 20 patients go through this process and performing the consulting role for many of them. And I've had many hard conversations with patients who've inquired about this as an option, and I've had to explain to them that there's a 20-day waiting period, and that many of them would not survive to avail themselves of this option, either not survive or no longer be able to swallow at that point, or no longer be able to make their own decisions at that point. And so then we have to discuss other options. So I think having the opportunity to waive the 20-day waiting period would really open this up to other patients who are currently not able to avail themselves of this option, and decrease the stress that patients feel about this. Because when patients want this to be their end of life plan, a lot of times they're very emotional about this being their end of life plan and committed to this plan. And when they find that they may not be able to utilize this plan, it can be very heartbreaking and very frustrating for them, because they feel like they ought to be able to be autonomous. And I agree. So I hope you do too. Thank you for listening.
Thank you very much, Dr. Love. We also have Bradley Kuo in support.
Hi there, committee. My name is Bradley Kuo. I'm the legislative committee chair for the Hawaii Association of Professional Nurses. We represent Hawaii's APRNs. We are in strong support of this measure, and we can be available for comments. Thank you so much.
Thank you very much, Bradley. Members, please note we also have late testimony from the Hawaii Association for Justice in opposition.
Aloha, Chair Johansson, Vice Chair Kitagawa, members of the committee, Evan Oya on behalf of Hawaii Association for Justice, or HAJ. We appreciate the intent of the measure. However, we are concerned with the language of the bill, as it prohibits certain medical records pertaining to euthanasia from discovery in civil cases. The language may have the unintended consequence of preventing discovery of relevant and important information just because that information is to DOH. For example, if a patient's medical records was sent to the department, then it could be argued that the patient or their family could not obtain the medical records during discovery. To address this concern, we have provided recommended language to make it clear that the relevant information remains discoverable from entities other than the department. Mahalo for the opportunity to testify. Will be available for questions. Thank you.
Thank you very much, Evan. We also have testimony from Stephanie Ann Marie Packer in opposition.
Sorry. Is there any way you can come back to me on the next one? I'm going to pull over right now. I'm actually
Okay, sure.
driving.
Yeah, we can do that, Stephanie. We'll come back to you. We have John Kelly in opposition. John Kelly in opposition.
Hi, thank you very much.
You're welcome.
My name is John Kelly, and I'm with the National Disability Rights Group Not Dead Yet. We oppose assisted suicide laws as deadly form of discrimination. Expanding these laws will only make matters worse. Assisted suicide is all about disability because the people who get lethal prescriptions are disabled, and we learned from Oregon that the top 5 reported reasons relate to distress about the disabling features of their serious illness, such as physically depending on other people, feeling embarrassed about personal needs, and feeling like a burden on other people. This bill authorizes physician assistants and advanced practice nurses to prescribe assisted suicide. This is a problem because their training and required skills are much less than those of doctors who already make lots of mistakes. 12 to 15% of people given a terminal diagnosis outlive their 6-month hospice stay. It clarifies that counseling can be provided by PAs and advanced practice nurses with specialized training. This is a problem because these sorts of providers are not generally trained or experienced in the emotional or practical aspects of coping with disability or the resources to address our needs. The bill reduces the waiting period between oral request and a prescription. This is a problem because it shortens the time for trying to address the person's concerns. Really, it just seems that the so-called safeguards in the original assisted suicide law were selling points, the bait, and now we're at the switch stage of the bait and switch, rolling back those supposed safeguards and revealing that the only real protections in these laws are the legal immunities granted to everyone involved in the suicide except for the patient. Thank you.
Thank you very much, John. Stephanie, are you ready? Stephanie Packer? I guess we'll continue on with Mary Ueda in support. Mary, go ahead. I can see you. We can't hear you, Mary. You might have to unmute. We're still not able to hear you, Mary. We can see your. Try now. There we go.
Oh, perfect. Good afternoon, representatives. Thank you for giving me the time. Living in Hilo has its challenges. I think we're unique in that on the Big Island, we've got multiple barriers beyond the one champion physician who has come to our aid for end of life choices for our patients. I was part of a group that organized an effort to support this law, and we finally got it in place, but we've got additional barriers beyond lack of physicians and the timing issues. For example, the CEO at Hilo Medical does not support any documentation of this law in the charts of patients or discussion of this law. So that's a barrier. We attempted to try to persuade him, but to no avail. Even the medical director of the institution has attempted to convince his CEO, but we're not going anywhere with it. Likewise, the hospice that we have here in Hilo does not support the law in an active way. I mean, they'll not prevent it, but basically they say that for cultural reasons, they will not promote it. So we've got other problems other than lack of physicians. But speaking of physicians, I did look at the law. Initially, I was opposed to having PAs involved due to their lack of being insured, because APRNs are independently and insured, and with an RX after their names, there's no question of their qualifications. I was an APRN myself, but after 30 years of nursing at Hilo Medical Center, I have at least 6 different scenarios of patients begging for a choice. And this is why I committed myself to this. One patient, in fact, packed his own loaded gun, and so it became a big incident involving the police. So, you know, we've got problems, and I think together we can solve them. Thank you all for listening.
Thank you very much, Mary. We appreciate it. I don't think she's here, but just because I'll just give her one more chance. Stephanie Packer, are you here? Okay, she is not. Members, please note that we have numerous other testimonies in support and opposition on this measure. Is there anyone wishing to testify on HB 1823 who I didn't call who would like to testify? Becky, please go ahead.
Aloha, Chair Johansson, Vice Chair Kitagawa, members of the CPC committee. Thank you, Chair, for taking my live testimony. I'm here on behalf of the Hawaiian Islands Association for Marriage and Family Therapy. And our testimony pretty much focuses on the provisions that relate to counseling in this bill. It's my understanding that the Senate companion SB 2680 SD1, the SD1 isn't available on the Capitol website yet, but at decision making, the chair had added marriage and family therapists to those who could administer counseling. And I just note that DHHS, federal DHHS recognizes 5 core mental health professions, and all of those professions are represented in the counseling provision except for marriage family therapists. So we would like to add that. And I'll just add my own sort of personal experience with this. My mother passed of a very aggressive uterine cancer, and I was her primary caregiver for about 7 months. And my grandmother was in hospice for the better part of a year during her last year, and my dad was her primary caregiver, and I was kind of backup. And I think that the counseling and the sort of expertise that marriage family therapists can bring in understanding family dynamics family systems and who's left behind, I think their expertise would be very valuable in this regard. So we humbly ask that you include MFTs into those who could provide the counseling. Thank you for taking my testimony. Aloha.
Thank you very much, Becky. I believe I've been told we have Stephanie Packer back with us in opposition.
Yes, thank you. I'm sorry about that earlier. My name is Stephanie Packer. I'm a mother of 4, and I'm testifying in opposition to HB 1823. In 2012, I was diagnosed with scleroderma, and I was given 3 years to live. As you can see, I've outlived that prognosis and relieved to still be here to care for my 4 children. Shortly after California passed its law to legalize assisted suicide, my doctors prescribed an expensive new treatment. When I asked my insurance company about coverage, my request was denied. I asked if they would cover a lethal dose of drugs under the new assisted suicide law, and I was told that they would cover those drugs for a copay of a mere $1.20. I was stunned that much cheaper and lethal drugs would be available to me rather than treatment that could save my life. Fortunately, I did eventually receive coverage for the treatment that I sought. My health journey has not been easy. I've been in and out of hospice for 5 years with predictions that I only had 6 months or less to live. Each time I qualified for the lethal drugs, and I do live in fear that with my next prognosis, that treatment will be denied in favor of cheaper lethal drugs. If a doctor can't accurately predict the amount of time that I have left to live, how can Hawaii now want to entrust these predictions to advanced practice registered nurses and physician assistants? My children need me. And recently I was sick and I was on a ventilator for quite some time in a hospital ICU for 2 months. And it was some of the worst time of my life. Pretty horrible. And if the waiting period had been shortened, then I'm not sure that I would still be here. Thankfully, I did not choose to take those drugs, and I was able to recover. And I'm so glad that that time was not permitted for me, because I think I could have easily made another decision. And there's so much I would have missed. And it was a decision that I would have made in that moment. The waiting time protects us from fear and depression and pain, and gives us an opportunity to consider more. As I said, my children need me. And as long as I can bear the treatment offered, I want to live. Please don't place mothers and other people in Hawaii in the position that I find myself in. I ask Hawaii legislators to vote against HB 1823. Thank you so much for taking time to listen, and I appreciate you calling me again.
Thank you, Stephanie. Is there anyone else wishing to testify in HB 1823 who has provided testimony and I haven't called? Okay, seeing no further testifiers, members, any questions on HB 1823? Vice Chair Kitagawa.
I guess I'll ask maybe Sam Trad this, since I think you probably are familiar with legislation across the nation. So one of the questions I have is, currently under the federal government's Medicare and Medicaid program, APRNs and PAs cannot certify or recertify that an individual is terminally ill and would qualify for hospice care. So I'm just wondering how APRNs and PAs are able to do that currently. And I know New Mexico just implemented their law last year, which is very new. They are the only state that allows APRNs and PAs to do this. And so I'm just wondering how they get around that federal government requirement.
Yes, thank you, Vice Chair Kitagawa. On that question, it's APRNs can refer patients to hospice. The way it works is that under the Our Care, Our Choice Act, they would be able to act as the attending provider and the consulting provider, as well as the mental health specialist, depending on their qualifications. And I actually wonder if maybe Laura Reichardt from the Hawaii Center for Nursing could better explain that. I don't know, Laura, if you want to talk about the referrals in the scope of practice for nurses, or maybe Leanne.
Well, I guess my question is more if there's a federal rule or regulation now that doesn't allow APRNs and PAs to certify terminal illness for hospice, which would be 6 months or less, how are they able to certify terminal illness under this bill?
So advanced practice registered nurses can diagnose terminal illness, and they can evaluate a prognosis of 6 months or less to live. I see Laura putting her video off and on. I think yes.
Sorry, 1 second, Sam. I'm just gonna clarify for everyone. If the vice chair wants to call in other people, she may, but until a member calls on someone, that's the official recognition. So I just so that we keep up protocols here.
Yes, thank you so much.
Sorry.
Yeah, thank you, Chair Johansson. Thank you. I apologize for not following protocol. I didn't realize that. So,
well, no, you weren't violating it. I can see. I can just see. I thought I would clarify, but no worries at all.
Okay, well, if Sam, if you don't know the answer to that, then I don't know if Laura knows it, then.
So do you want to go ahead, Laura? Do you want me to try to answer?
Yeah, I could give an example if that's okay, Vice Chair Kitagawa. A good example of this is with the CARES Act. APRNs were granted the authority to refer to home health services federally, but that authorization has actually been established in state law far before the CARES Act. And so as it relates to scope of practice, there are laws that can be barriers to certain services or to certain business lines, if you want to think of that from an insurance perspective. That doesn't mean that there's not the education and training or competencies to engage in that type of care, but it is just restrictive from a legal standpoint for certain services. So those restrictions would be to federally for Medicare, but it wouldn't necessarily, that's not an indication that there is not competency by that type of professional for the APRN.
Okay, no, yeah, it has nothing to do with competency, but I'm just wondering how, like, for example, right, New Mexico has it in law. So how do they get how is that, I guess, how do they get around that if there is a federal law that says they cannot certify terminal illness, or APRNs and PAs cannot certify terminal illness for hospice, which is the 6 months or less to live? So how did they do that so it's, okay?
Thank you for clarifying. So I'm not familiar with how New Mexico did it in particular, but because this would not be certifying terminal illness for hospice, but it would be for a different program, that exclusion would be separate. So it's almost like a Venn diagram where because it's not for hospice, it does not apply.
So under Medicare though, still they are allowed to certify for terminal illness for like medical aid in dying programs.
I'm not able to answer that question. I don't understand, or I'm not knowledgeable how it's billed. What I can tell you is that, for instance, if it's billed by Medicare or if this is just a program of the state. And so I think that's a nuance that I'm not able to respond to, and I'd be happy to defer to Department of Health on that.
Okay, yeah, and it seems like Lauren Kim is saying that it just depends on how it's billed.
Yes, Vice Chair, it depends who pays for it. There is a federal prohibition on funds being used for intentional termination of pregnancy / abortion and assisted suicide. Our law specifically defines activities under the Our Care, Our Choice Act as not being suicide, but there's no telling how a federal lawyer will interpret that. So people steer clear of it. And there's an understanding that Medicare monies will not be used to pay for bed space or for the drug, in this case for Our Care, Our Choice Act. So a state may avail itself, if you are private insurance and you enter hospice and state law allows or authorizes an APRN to certify you, that's our business as long as we're not billing CMS. Then the feds keep out of it. That's just state health policy. There's 50 states, 50 different state labs of health policy. So I hope that gives you a better sense of the lines of demarcation between federal funds and their rules and how states decide to deploy scopes of practice and lines of business, as Ms. Reichardt said.
Okay, great, thank you. Can I ask a couple?
Please, go
Okay.
ahead.
And maybe Sam, I can go back to you. So this is specifically, and I'm assuming that you probably helped maybe draft this legislation, so you might know, but in the bill on page 8, it says that an attending provider can waive the waiting period of 15 days if it's deemed the patient will die within those 15 days. So does that mean that the patient needs to then can make the second request at any point within that? So even if like you're sitting in the same meeting right now and in the next 5 minutes, the patient could say, I'd like to now make my second request if the attending provider says you don't have the 15 days? Or is there still a time frame that's supposed to happen?
The way the law is, the way the bill is written for Hawaii is that it would be up to either the attending provider or the healthcare system the attending provider is with, the hospice the attending provider is with. So there's still 17 steps that the patient would have to follow. But the oral request between the first and second oral request would be waived, and they could make the second oral request as determined by the attending provider.
So there would be no time frame on it. It could be as short as like the next minute.
For the minimum, well, I think yes, but it would be up to the attending provider, and they would still have to have a third mental health assessment. So they would still have another consultation with the mental health provider, as well as another consultation by another consulting provider. So the patient will still be seeing two different qualified medical providers, as well as a third mental health provider. So again, there's still 17 steps. They also have a written request that they would still have to fill out and have signed by two different qualified witnesses. So it's not something that would happen. There still would be a long, it would still take a few days to be able to obtain the prescription.
Okay. And then, sorry, one last question. And I'm not sure who, it might be Department of Health, just because I don't see anyone who maybe is with the physician assistant group, but under the counseling section, this bill now allows physician assistants to serve as a counselor. And I'm just wondering, because as we discussed last week, physician assistants are not specialized, right? They're generalists. And in the bill, it specifically lists out certain counselors, and APRNs now have to have their certain specialization. But as a physician assistant, if you're a specialist, would you be qualified to serve as a counselor in this capacity?
Thank you for the question, Vice Chair. Unfortunately, the Department of Health is the inappropriate agency to provide factual feedback on that. That is a scope of practice issue. Most of this is a scope of practice bill for which the department has a ministerial function, and I'm sorry, I need to defer to the whatever relevant board. Could be the medical board that governs physician assistants. I'm not quite sure. Sorry, I'm not in a position. My department is not in a position to respond to your question.
Okay, no problem. Thank you. Yeah, and I don't think the medical board's here, so that's okay. Thank you very much.
Okay, thank you, Vice Chair. Members, any additional questions on HB 1823? Okay, seeing no further questions, then we'll move on to our next agenda item. HB 1977 relating to dental assistants. This allows dental assistants to perform limited duties under general supervision of a dentist in public health settings. On HB 1977, we have our first testifier, the Department of Health.
Good afternoon. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department stands on its testimony and support, and I'm here to answer any questions you may have. Thank you.
Thank you, Department of Health. Next for this bill, we have the Board of Dentistry, Sandra Matsushima.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, and members of the committee. Sandra Matsushima, Executive Officer for the board. The board stands on its testimony in support, offering comments, and I just wanted to add that Dr. Hasegawa was unable to provide the testimony as he needed to leave to tend to a patient. But thank you.
Thank you so much. Next, we have testimony and support from the Hawaii Oral Health Coalition, Hawaii Public Health Institute, Patrick Donley.
Hi, good afternoon, Chair Johansson, Vice Chair Kitagawa, and members of the committee. Thanks for the opportunity today. We stand on our testimony in support of the intent of this bill with recommendations for amendments. Thank you very much.
Thank you. Next, we have supportive testimony from Aloha Care, Peggy Merswa. Is Peggy here? No? Okay. Is there anyone else here to testify on HB 1977? Committee, can please note that there are additional supportive testimony from organizations as well as individuals. Does anyone have questions on HB 1977? Seeing none, we'll move on to the next bill, HB 1980, which is related to telephonic services permits, but does not require or prohibit Medicaid health insurers, mutual benefit societies, and health maintenance organizations to cover telephonic behavioral health services under certain circumstances. Clarifies that telephonic services do not constitute telehealth. First up to testify, we have DCCA Commissioner Colin Hayashida with comments.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, Insurance Commissioner Colin Hayashida for the Department of Commerce and Consumer Affairs. We stand on our written testimony, offering comments. I would just like to add that we do know that there are health plans that pay for telephonic services in an equitable manner, as the current statute does not prohibit a health plan from offering telephonic services. Additionally, Medicare currently under the public health emergency is paying for some services in parity, but it is uncertain whether or not that is going to continue past the public health emergency. And finally, should this measure move forward, the division is willing to assist in any drafting of language to help the committee. Thank you.
Thank you very much. Next, we have supportive testimony from the Department of Human Services. Judy.
Hi, good afternoon. I'm Judy Moore Peterson. I'm the MedQuest Administrator for the Department of Human Services. We stand on our written testimony. We support the intent of this bill and we offer comments. Thank you.
Thank you. Next, we have comments from Healthcare Association of Hawaii, Paige Heckathorn Choi.
Hi, good afternoon, Vice Chair Kitagawa. Thank you for the opportunity to testify, stand on our comments. We want to just emphasize that telehealth has become an increasingly important way that many patients do receive care from a number of our member hospitals and member providers. We do believe that many more conversations need to be had around the expanded use of telehealth and how it's best used. And we just want to make sure that any policies don't preclude us from innovation in the future. Thank you.
Thank you. Next, we have testimony from Hawaii Pacific Health, Michael Robinson. Michael here? Nope. He provides comments. Next, we have a supportive testimony from the Hawaii Primary Care Association, Eric Abe. Eric here? Eric is not here. Next, we have supportive testimony from AARP Hawaii, Audrey Suga Nakagawa.
Good afternoon. I'm Audrey Suga Nakagawa from AARP, and we stand on our written testimony supporting the intent of this bill. We just want to make a comment that was also mentioned by the DCCA commissioner. We find that some of the opportunities in this bill are rather limited and would recommend that audio only telephonic also be included, which is sometimes preferred by the patient. And as stated, the Medicare, the federal Medicare already allows that without any type of stipulation. And so, we'd like to make sure that it's consistent. And also there is some limitation that the patient needs to be seen by the physician within the 12 months. And, if the visitation doesn't require a face-to-face type of visit, we believe that, it should be allowed without a requirement like this. Given with the COVID situation, people are still very fearful and minimizing any type of in-person contact. So, we like to just make sure that these options are available. Thank you.
Thank you very much, Audrey. Thank you very much, Audrey. Next, we have HMSA in support.
Good afternoon, Chair, Vice Chair, and members. My name is Lindsay Garcia on behalf of HMSA. We stand on our testimony in strong support and are available for any questions. Thank you for the opportunity to testify.
Thank you. In 1980, we also have Alex Lichten, the Hawaii Psychological Association, in support.
Good afternoon, everyone. Thank you for the opportunity to testify. The Hawaii Psychological Association supports the intent of HB 1980. We are concerned about some of the specific provisions in the bill, which we think will do the opposite of what the bill is intended to do. And it could restrict audio only sessions. For example, video technology may be available. However, many senior citizens prefer audio. Somebody that has decreased manual dexterity or declining eyesight may choose audio. Very often a session may start out in video and then there's a loss of internet connection, and the session is finished over the telephone. Would those sessions be covered? I just want to emphasize that research increasingly shows that audio sessions are just as effective as video or in-person sessions. And for people with social phobia, there's research to suggest that it's more effective for those persons. Audio only sessions are overutilized or utilized at a very high rate by seniors, people over 55. As age increases, so does the preference for audio sessions. There was one study that showed that Asian Americans are 30% less likely to use video sessions, are more likely to prefer audio sessions than others. There was one national study that looked at 180,000 scheduled video visits, and half of those did not occur. And then of the other half of them were audio only sessions that did occur. And, in a crisis situation, even if the person hasn't been seen in person in the last year, telephone has been effective for a long time. For example, suicide hotlines I'm told that the Golden Gate Bridge in San Francisco, where many people have gone to commit suicide, has a telephone hotline right on the bridge. So that just illustrates the importance of making sure we don't restrict audio sessions unnecessarily. And I meant to mention that we prefer that the language be inserted into the bill, that the Centers for Medicare and Medicaid Services, CMS, uses, which includes telephone and audio-only communications technology in their definition of interactive telecommunications system. Thank you very much.
Thank you very much, Alex. We also have JC Michaelonic from the Queen's Health System offering comments.
Aloha, Chair, Vice Chair, members of the committee. JC Michaelonic on behalf of Queen's Health Systems. We'll stand on our testimony offering comments, but certainly supporting the intent of this measure. Thanks so much.
Thank you very much, JC. We also have Jonathan Ching with Kaiser Permanente offering comments.
Good afternoon, Chair, Vice Chair, Jonathan Ching for Kaiser Permanente. You have our written testimony offering comments. I just want to highlight a couple of things. Kaiser is really in strong support of inclusion of audio only, for purposes of telehealth. But that being said, we do have some concerns that the bill as currently drafted are a bit too restrictive, particularly those requirements for telehealth services, especially when they may be technologically unavailable to a patient. And we would prefer that the legislature advise against the legislature trying to impose really rigid in-person parameters that may fail to account for the patient and provider's needs. So, we would prefer a more broad brushstroke. And certainly, I think as some of the previous testifiers have mentioned, I think there's a lot more conversation that providers and the insurers are continuing to have on this conversation. So certainly supporting the intent. We hope the committee, decides to move it forward, but understanding that there's still some things that we believe need to be addressed. Thank you.
Thank you very much, Jonathan. We also have the Hawaiian Island Association for Marriage and Family Therapy in support.
Aloha, Chair, Vice Chair, members of the committee. Becky Gardner here on behalf of Hawaiian Islands Association for Marriage Family Therapy, and also testifying on behalf of the National Association of Social Workers Hawaii chapter. Our organizations are in support of this bill to the extent that it actually expands access. And I take note of the insurance commissioner's testimony, and it was in his written testimony on the original version of this bill, that as drafted, this may actually be more restrictive, and it may actually limit the types of coverage that already exist for telephonic services, because the bill as drafted would require all plans to have an in-person visit every 12 months, and also that the technology for the telehealth visit is unavailable. So our organizations, we want to have some clarity on what does unavailable mean. We've heard a lot of testimony today from those supporting Our Care, Our Choice, those who are elderly. Perhaps a lot of folks just aren't able to come into the office, to a therapist's office. Requiring an in-person visit would shut down a number of practices that are exclusively telehealth. So we think that, especially in mental health contexts, it might be arbitrary to require an in-person visit when perhaps there's a social phobia, pandemic rules are in place. It might make sense in a lot of physical contexts where you need to have an actual face-to-face checkup, but for mental health, which uses talk therapy, it's not so necessary. We also think it's really important. There was recent research done by DHHS. They just issued a policy brief on February 2nd, and a link to it is in my testimony. And they looked at the utilization of audio versus video telehealth over the pandemic. And they've discovered that there are very clear disparities along the lines of race, ethnicity, age, education, income, health insurance coverage, English proficiency. Those folks prefer to use the phone. And if we don't allow them access through the phone, we're really going to be restricting coverage and perhaps to the populations that need it most in the wake of the pandemic. Finally, I just want to note that the CMS language, this is something our groups are looking at, and we're certainly amenable to further discussions on what CMS has been working on and how they're grappling with this issue as we're opening up. And we have met with HMSA. We're looking forward to hearing more from them on ways they think that this bill can work and how we can get behind it. We also have a meeting with the commissioner coming up. So we're happy to collaborate on getting a bill that's actually going to expand access through the telephone. Thank you for taking our testimony. Aloha.
Thank you very much, Becky. Members, please note we have other testimony in support and providing comments on this measure, but indicating that they wouldn't be present to testify. Is there anyone else wishing to testify on HB 1980? Okay, seeing no further testifiers. Members, any questions on HB 1980? Okay, seeing no questions on HB 1980, then we'll move on to our next agenda item, HB 2260. This is relating to cannabis. And this would expand the medical cannabis dispensary laws and regulations to allow for transport within islands between dispensaries to sell to other dispensaries to fill in some of the shortages, as well as changing the fee structure and making various and other substantive amendments to the underlying dispensary law. On HB 2260, we have our first testifier, Department of Health, offering comments.
Good afternoon, Chair, Vice Chair, and members of the committee. This is Keith Ridley, Chief of the Office of Healthcare Assurance on behalf of the Director of Health. Thank you for accepting our testimony with comments and noting that we do have a mix of support and opposition on the several issues that are in this bill. And allow me to summarize each one very quickly. On the sale and transport between dispensaries, the department supports that. And while the department has no specific position on HD1's change in the amount of cannabis that can be transported, the department prefers and recommends that the criteria on sales and transportation be in rules rather than codified in statute. The department does have interim rulemaking authority under 329D, and as a result, the department requests the amendment at the end of our written testimony. And we have two other items for amendments as well. On the second item, on increasing plant count, while the department takes no position on the number of plants a dispensary may cultivate, the department opposes any specific number codified in statute. We think that the department may be in a better position to determine the number of plants in a given production center based on the dispensary's production center capability and capacity. And as a result, the department requests the amendment again at the end of its written testimony. On the third item of increasing the number of production centers, the department opposes an increase in production centers as not needed, and especially if the plant count limit is eliminated in statute. Presumably, the additional production center would be to allow for an increase in numbers of plants, but if the plant count limit is eliminated, then it would appear that the increased number in production centers would not be necessary. And if the legislature were to feel that additional production centers would be necessary, then the department would suggest that we could issue more licenses as is currently authorized under the current rules. On the fourth area, increasing the number of retail store locations, the department supports one additional retail store location for a total of no more than 4 retail locations. And again, if the legislature believes that that for patient access, there should be more retail stores, the department would be looking at issuing more licenses rather than just increasing the number of stores to the limited number of current licensees. As a result, again, the department requests the amendment at the end of its written testimony. On the fifth item of redefining production centers, the department opposes this as not needed, similar to the opposition on the number of production centers. On the sixth item, establishing additional fees, the department supports authorization for the department to establish a fee structure in rules rather than for fees, except for fees for additional production centers, which the department opposes as not needed. On the last item, the establishment of standards, the department supports this proposed amendment. And again, at the end of our written testimony, we do offer 3 amendments to this bill. Thank you very much.
Thank you very much, Keith. We also have the Hawaii Cannabis Industry Association in support.
Aloha members. This is Randy Gantz with the Hawaii Cannabis Industry Association. We believe this would be a really crucial bill at a very critical time for our industry. The industry weathered COVID. It's coming off its 5th year of operation and should be starting to pick up some momentum. But unfortunately, we're seeing a regression and in particular, a large issue in regards to patient access. HICIA, we conducted an industry report with economist Paul Brubaker this year, had sent that out to members to review, and it really highlights this lack of patient access issue as one of the major findings. So with roughly 35,000 registered patients statewide, only 13,000, so less than half, are utilizing our dispensaries where medicine is tested and regulated, which is the intent of our program. This leaves about 20,000 patients, 1,000 more who use medical cannabis but have chosen not to register to seek medicine from untested and unregulated sources. Additionally, we are seeing a tapering off of new patients who are registering, utilizing our current dispensary system. And these trends are troubling and paint a bleak outlook for the tested, regulated, and taxed program that lawmakers carefully put together years ago. So we direly need changes to ensure the program is on its path to meeting current legislative intent and possible growth in the future. That's why we're asking for those 3 main provisions: increasing retail limits to 5 and allowing Department of Health to have discretion and allowing 2 additional locations for underserved areas, expanding production limits for licensees. Currently, it's kind of a blanket for all licensees across all counties. And as we know, counties are different and licensees are different, and have that flexibility is really important to make operational decisions for what's best to serve patients on your given county or given island. And lastly, the wholesale between licensees, another really core tenet of having a program that's solidified to support one another to make sure that we have access to patients. We appreciate the opportunity to testify. I'm available for questions. We've worked really hard on this legislation. We feel like it'll really provide us the necessary steps towards solidifying a good patient market. Thank you so much.
Thank you, Randy. We also have Tai Cheng with Aloha Green Holdings, Inc. in support.
Hello, good afternoon, Chair and Vice Chair. Thank you for giving me the opportunity to testify. Aloha Green is one of 3 licensed medical cannabis dispensaries here on Oahu. We support HB 2260 with comments. We ask that the committee consider either raising or removing the transportation limit on wholesaling between licenses. We feel that currently there is no rule and no regulation on the amount of cannabis medicine that we transport between our production centers and to retail locations or between retail locations, and that by placing this arbitrary number of 20 pounds of cannabis flower equivalent would place our transportations at undue risk and also increase the cost of moving product from one location to another. The increased number of transportations that will be required because of that number would mean that our personnel, our security personnel, as well as the employees that need to transport, which is 2 employees at least with each transport, would make it much more difficult and make it much easier for any type of criminal element to identify the transport of that product. In the 5 years of the program, we have not had any issue with criminal robbery or any type of theft. But when cannabis is transported between our sites, it is the most vulnerable time for the product and the highest risk for the company and for the public. Thank you very much for your time, and I'm available to answer any questions from the committee. Thank you.
Thank you very much, Ty. We also have Noah Phillips with Hawaiian Ethos in support.
Hi, aloha. Good afternoon, Chair, Vice Chair, members of the committee. Thank you for allowing me to testify today. I'm testifying on behalf of Hawaiian Ethos. We're one of the medical cannabis licensees on the Big Island of Hawaii. We would like to stand on our written testimony today and make ourselves available for any questions for the committee today. Thank you.
Thank you very much, Noah. We also have Casey Rothstein from Green Aloha Limited in support.
Good afternoon. Thank you for the opportunity to comment today. I'm Casey Rothstein of Green Aloha. We're the Kauai dispensary license. We are in strong support of this bill with some comments. We believe it addresses a few key issues that are holding back the dispensary program. Specifically, I'd like to speak about why it's necessary to define a production center to allow multiple buildings within the same secured fence line. I believe there are many reasons why functionally and logistically it would make sense to separate parts of production in the different buildings. I won't list them all today, but it's simply more costly and more time consuming, particularly on outer islands, to permit and build one extremely large building big enough to house the full plant count allowed, drying area, processing area, manufacturing space, than it is to separate these into multiple smaller buildings, allowing licenses to expand as needed. Specifically to our license on Kauai, we have one production center where we squeezed roughly 2,500 plants, or half the current maximum count, into our building, which is only 3,800 square feet. Originally, many manufactured products and edibles were not allowed, and our facility was not built with the space for them. Once more manufactured products became approved, we added a 20-foot converted shipping container to serve as our lab and manufacturing area. We placed this within our secured fence line, physically touching the production center. But because it has a separate entrance about 15 feet from the production center's entrance, the Department of Health has determined it to count as our second and final production center. This is why this new definition of a production center to include multiple structures within the same secured fence line would allow the licensees to split up the areas of production to best fit their needs and to grow with the infrastructure available as rules and plant counts potentially change if we hadn't already built a building big enough to predict the future of the industry's growth. If we were allowed to build and expand in a more affordable way, it would enable us to reach economies of scales, which would bring down prices and in turn bring more patients into the dispensary program away from the untested, unregulated, and untaxed product that is available at a lower price on the street, which after all was the founding goal of the dispensary program. This bill will help us better achieve this goal. Thank you for your time. I'm available for questions.
Thank you very much, Casey. We also have Jacqueline Moore with Big Island Grown in support.
Aloha, thank you so much for the opportunity to testify. My name is Jacqueline Moore, pharmacist and CEO with Big Island Grown. We are in strong support of this bill. The provisions in this bill provide a reasonable increase to the existing footprint, which strengthens legal infrastructure by expanding licensees' ability to scale production and provide better economies of scale. A lot of the major points have already been covered by some of the other licensees, but I will just say that, to Mr. Ridley's point about increasing and opening up new licenses for anything beyond four locations for licensees, please know that some of these areas we're talking about, these underserved areas, are very rural and in and of itself are not viable licenses. A lot of licensees have opened up locations in the most densely populated card populations just to be able to break even. And so we can absolutely absorb a fourth or fifth location in these more rural underserved areas, but opening it up just as a licensee, for a licensee in and of itself, it's just not a viable business. And we would be setting people up for failure. So thank you so much. Aloha.
Thank you very much, Jacqueline. We also have on-time testimony from Clifton Otto offering comments.
Yes. Good afternoon, Chair, Vice Chair, members of the committee. My name is Dr. Clifton Otto. I'm a cannabinoid medicine specialist and a certifying provider for Hawaii's medical cannabis program. Thanks for the opportunity to offer comments today on this measure. There are two major issues that I believe need to be addressed in this bill. The first relates to consumer protection and the fact that our patients and dispensaries must violate federal law to participate in Hawaii's medical cannabis program. This conflict is causing unnecessary discrimination against our patients and dispensaries and needs to end. The second issue relates to commerce and the ability of dispensaries to transport cannabis material between islands. There is no clear reason why such transport is being prohibited, especially when a legal pathway already exists. I'm offering two simple amendments that would address these issues. I hope you will add these amendments to this measure, especially the First Amendment, which was unanimously adopted by both chambers of the legislature last session in HCR 132, so that at the very least we can continue this important discussion. Thank you for considering my testimony. I will be available for questions. Aloha.
Thank you very much, Dr. Otto. We also have late testimony members from Care Wailua Farm, Jason Hanley, in opposition.
Aloha, representatives. I'm honored to be here. First of all, thank you for being our civil servants for Hawaii, a tireless job that aims to better our communities. My name is Jason Hanley. I am the owner of Care Wailua Farm, the largest 3 to 9 patient cooperative farm in Hawaii, with over 1,000 licenses on site of cardholder patients. I oppose HB 2260. Dispensaries have now had their doors open for 5 years and haven't given the medical card holders of Hawaii affordable medicine. The number one reason people don't go to dispensaries is the cost. Dispensaries charge approximately $480 an ounce, while the cost of them is approximately $70 an ounce to produce, almost a 700% markup. Colorado's medical program 10 years ago has remained at $250 an ounce, almost a third of what Hawaii charges patients. So if dispensaries are making a profit, then why don't they lower the costs? Dispensaries are being influenced by their shareholders, which are large investment firms wanting a quick return on their money and control the cannabis market in Hawaii. Why are dispensaries asking for more retail sites, plant centers, and distribution between islands? Dispensaries want the monopoly on Hawaii's cannabis market and want to keep it vertical, resulting in no participation by the citizens of Hawaii. I have tried personally to meet with owners and join in dispensary associations and have been denied even a voice at the table. Sorry, I should get a bit married. Sorry.
No problem, you're fine.
Yeah. Dispensaries complain that cannabis cooperatives are taking away business and are not regulated. We are a regulated cannabis farm and have had compliance checks by all local, state, and federal law enforcement agencies. Patients participate in growing their own medicine and sharing resources such as rent, water, nutrients, and testing with a market cost value of about $150 an ounce to themselves. States like Maine have revived their cannabis programs by developing regulations for a horizontal program, effectively extinguishing the black market and providing licensees to local people, generating thousands of jobs and new businesses while maintaining safety in their communities. Most important part, safety in their communities. For Hawaii, cannabis is the new age of agriculture crop. And the money generated from cannabis can help to fund local farm food production, help to identify and fund programs to address education, homelessness, and poverty, and many more. I invite all legislators in this meeting to our farm. Care Wailua Farm has been visited and gained support from Lieutenant Governor Josh Green, State Senators Michelle Kadani and Donovan De La Cruz, State House Representatives Cedric Gates, Sean Queenlan, Gregory Illigan, and Daniel Hote. Please do not allow dispensaries to run this program and claim they are in dire straits. A review of the financials will show that even with 20% of Hawaii cardholders and out-of-state cardholders purchasing cannabis, they are making a profit. Mahalo, and I'm available for questions, and I'm honored to be here giving testimony. Thank you.
Thank you very much, Jason. Members, please note we also have testimony offering support and comments provided on this measure as well from those indicating they wouldn't be here to testify. Is there anyone else wishing to testify in HB 2260? Okay, seeing no further testifiers on HB 2260. Members, any questions? Okay, seeing no questions, then we'll move on to our next agenda item, HB 1971, relating to peer-to-peer car sharing. And this would authorize peer-to-peer car sharing and establishes regulations thereof, including insurance requirements. On HB 1971, we have our first testifier, Department of Taxation, in support.
Good afternoon, Chair, Vice Chair members. Josh Michaels, Department of Taxation. We'll stand on our testimony. I'm happy to answer any questions. Thank you.
Thank you very much. We also have Office of Consumer Protection in opposition, Michael Moriyama.
Good afternoon, Chair, Vice Chair, and committee members. Michael Moriyama for DCCA's Office of Consumer Protection. The Office of Consumer Protection stands on its written testimony and would like to reiterate its concern that adequate consumer protections be enacted in the regulation of peer-to-peer car sharing. As many people have testified, consumer protection is one of the main goals of any peer-to-peer regulation. Having clear and appropriate insurance requirements comprise an important element of consumer protection, but recall provisions, disclosure, record keeping, and verification requirements, and providing a means of enforcement are also crucial. With regard to insurance, OCP advocates for a uniform and adequate amount of insurance to be required of all peer-to-peer car sharing platforms. Currently, one platform offers $750,000 of coverage for the share card owner that pays only if the share car owner is liable for damages. The $750,000 of insurance is not guaranteed or automatically provided for the shared car driver. OCP continues its support of the proposal that $1 million of primary liability insurance be required of all platforms to cover the shared car during the shared card period. I'm happy to answer any questions. Thank you.
Thank you very much. Next, we have Tom Yamachiko with the Tax Foundation of Hawaii offering comments. Because he is not present. We also have Allison Ueoka with the Hawaii Insurers Council in support.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, and members of the committee. Allison Ueoka for Hawaii Insurers Council. We'll stand by our testimony in support of the bill with comments, and I'm happy to answer any questions. Thank you.
Thank you very much, Allison. We also have Matt Tsujimura with Enterprise Holdings in support.
Aloha, Chair Johansson, members of the committee, Matt Tsujimura on behalf of Enterprise Rent-A-Car. We'll stand on our written testimony in support of HB 1971. Happy to answer any questions.
Thank you very much, Matt. We also have Tammy Bowie with Turo offering comments.
Aloha, Chair Johansson, Vice Chair Kitagawa, members of the committee. I'm Tammy Bowie on behalf of Turo. We have submitted written testimony with comments, but I did want to be able to share a few things. First, thank you, Chair Johansson, as well as Representative Aquino, for your continued leadership on establishing a fair regulatory framework for peer-to-peer car sharing. I did want to clarify what Turo offers, given some of the discussion that took place at the last hearing. So first, every host or car owner has $750,000 of liability coverage. Every guest or car driver is guaranteed the minimum liability coverage required by state law. Guests do have the option to purchase up to $750,000 in liability coverage. And so as a result of that, there is no possibility where there is a transaction on the platform where there would be a gap in coverage. I would also like to add that many of these are personal cars. And so people who own and share their cars are driving their own families in these same cars. So they have every incentive to ensure that these cars are safe for use. I did also want to address again the comparisons made to higher coverage requirements in place for TNCs like the Ubers and Lyfts, as our business models are completely different. The $1 million requirement only applies when a for-hire driver is driving a paying passenger, which is never the case with peer-to-peer car sharing. And that is reflected in the significantly lower coverage requirements in effect when a TNC vehicle is not driving a passenger. Analogous circumstances, rental car companies and individual car drivers are not required to carry coverage higher than state minimums, and the risk on the road is equivalent to peer-to-peer car sharing. We don't see factual or policy basis for the assumption that peer-to-peer car sharing involves a greater risk, let alone more than 10 times greater risk than any other permissive use, including rental car or a Hawaii car owner allowing a family member or friend to drive their car. So we maintain that peer-to-peer car sharing should not be held to a different standard. And if that minimum is increased in this bill, that they should apply to rental car companies as well. Finally, we do understand that there is a desire to create a baseline of coverage to ensure proper protections are in place in the marketplace. And we would like to share that 19 states to date have passed peer-to-peer laws that do not require us to carry higher than state minimums. I truly appreciate the opportunity to provide these comments, Chair, for your consideration, and I'm available for any questions. Thank you.
Thank you very much, Tammy. We also have Soledad Roybal with Get Around offering comments.
Aloha, Chair Johansson, Vice Chair Kitagawa, and members of the committee. Mahalo for the opportunity to testify today. My name is Soledad Roybal, and I am a public policy manager at Get Around. And as you may recall from the last time I testified before this committee, Get Around is a fully digital and contactless car sharing marketplace that recently started to operate in Hawaii. Our product makes lives better by allowing those who don't own a car the option to use an affordable vehicle when they need it, and it's done on an hourly basis. Our patented Get Around technology also provides local car owners an opportunity to earn extra income by sharing their cars with minimal disruption to their lives. Peer-to-peer car sharing is different from the TNC model of Uber and Lyft, like Tammy just said. Under the TNC model, riders enter vehicles being driven by strangers who drive them to locations that they may be totally unknown to that driver. By contrast, a Get Around guest begins a trip by locating and unlocking an unoccupied car parked, and it's a car that they've booked, which they will drive to a location of their choosing. Get Around is unaware of any data that demonstrates that users of peer-to-peer car sharing are any greater an insurance liability than the average driver, including those who use traditional rental car services. According to HB 1971, accordingly, HB 1971 appropriately requires that peer-to-peer car sharing platforms guarantee auto insurance coverage in the amount that meets the state's minimum coverage limits. The same coverage that applies to those that are driving their own cars or people who rent cars in Hawaii. In fact, Get Around includes insurance coverage for every trip that exceeds those requirements. We do have additional questions, concerns, and suggested amendments that we've outlined in the red line version of this bill that we provided. I'm available if you or any committee members have any questions on these comments. Mahalo for your consideration on our written and oral testimony.
Thank you very much, Soledad. We also have late testimony from Commissioner Colin Hayashida with the Insurance Division offering comments.
Chair, may I testify?
Yes, please go ahead, Insurance Commissioner.
Thank you, Chair Johansson, Vice Chair Kitagawa, members of the committee. My apologies for the late testimony and for revising that testimony, but we just wanted to make clear that to summarize that the Insurance Division prefers the insurance provisions be set forth in HB 1619 HD1 with the amendments we provided for that bill. And I believe you may be getting that revised testimony. So we thank
you.
Yeah, thank you for the opportunity to testify.
Thank you very much, Commissioner. We also have Mike Yosua with the Hawaii Association for Justice in support.
Hello, Chair, members of the committee. Mike Yosua on behalf of the Hawaii Association for Justice. You have our written comments. Just want to note, we do have concerns with Section 2 regarding the minimum insurance requirements. We concur with the Insurance Commissioner and Office of Consumer Protection's proposals on those minimum requirements. I think there are important policy reasons for $1 million minimum coverage, and happy to answer any questions if the committee has any. Thanks.
Thank you very much, Mike. Members, that's the extent of those indicating that they would be present virtually to testify in HB 1971. Is there anyone else wishing to testify in HB 1971? Okay, seeing no further testifiers, members, any questions? Okay, seeing no questions, then we'll move on to our next agenda item. HB 1519, and this is relating to sunscreens beginning January 1, 2023. This prohibits the sale, offer for sale, or distribution in the state of any sunscreen that contains active ingredients that are not generally recognized as safe and effective by the Food and Drug Administration without a prescription issued by a licensed healthcare provider. On HB 1519, we have the Department of Health offering comments.
Good afternoon, Chair Johansson, members of the committee. I'm Diana Felton. I'm the toxicologist with the Department of Health. The Department of Health stands on our written testimony, and we're here to answer any questions. Thank you.
Thank you very much, Diana. We also have Brian Nielsen we have DLNR offering comments.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, and committee members. This is David Sakota for DLNR. We stand on our written testimony, appreciating the intent of the measure and offering comments. Thank you.
Thank you very much, David. We also have Lynn Miyahiro with public access to sunscreens in opposition. Lynn, I think you have to unmute yourself.
Oh, sorry. Thank you. Hi, my name is Lynn, and I'm here representing the Public Access to Sunscreens Coalition. We stand on our written testimony in opposition to this bill, and I wanted to share some important data that was actually from the Department of Health, the Hawaii Health Matters dashboard, and the number of adults. We all know that sunscreen is an important skin cancer prevention tool, and this chart should be alarming to people. The number of adults in Hawaii who have reported at least one sunburn in the last 12 months has more than doubled actually since 2017. This is 2018, 2019. So what happened between 2017 and 2019? Did the sun get stronger? No, but we did pass a sunscreen bill that banned certain chemicals. It didn't ban all, it only banned two, oxybenzone and octinoxate, but this just shows how stigmatizing the use of sunscreen has caused a decline in sun-safe behaviors. And what's really bad is that many of these people who are getting sunburn are younger. So their sun damage is going to come later in life. I also want to point out there are more and more coral reef scientists who are questioning the science behind the sunscreen bans. And one example is Dr. Ku'ulei Rogers, who's the principal investigator at the Coral Reef Ecology Lab. And she was asked by the Star Advertiser about sunscreen threats at Hanauma Bay. And in an article on November 20th, she was quoted saying, "There is no strong evidence to state that sunscreens threaten coral reefs." She goes on to say, "Our Coral Reef Ecology Lab has not seen the effects of sunscreen use on bleaching in our monitoring efforts. And if there were effects from sunscreen, it would be evident." And Dr. Rogers and her team, they're well respected, and they've been studying Hanauma Bay for over 20 years. And so we can be sure that if her and her team really thought sunscreen was a major threat, they would see it in their research. So these attempts to ban sunscreens that people use every day to protect themselves from UV rays isn't a balanced way to protect both people and the environment. I'd like to make an analogy where this would be like banning fluoride toothpaste and not thinking about the oral health implications that would have. So I ask our legislator to hold off on and defer passing this bill until we have more stronger evidence that could point to how sunscreens and interact with both human health and the environment. So thank you for the opportunity to testify.
Thank you, Lynn. We also have Patrick Ellison and Kenneth Tomeki from the Hawaii Dermatological Society in opposition. Anyone from the Hawaii Dermatological Society in opposition?
Yeah, George Martin here. I represent the Hawaii Dermatologic Society and the Academy of Dermatology. Thank you, members of the committee, for hearing me. This is a well-intended bill, but it's sadly misguided. It's in front of some very important science that's taking place right now. In April of May of this year, the National Academy of Science is a subcommittee on sunscreen safety will provide us with a vital piece of information. It will tell us, do these sunscreens affect the aquatic environment from lakes to oceans to coral reefs? That data is not in yet. Number two, it will tell us when we take sunscreens currently available out of the market, who will die of skin cancer because we've removed sunscreens. And so that's an important white paper to come out in the upcoming months. So this bill is way in front of that scientific data. The second thing that's very important is the FDA will come out in the next few months on the effect of sunscreen on human safety from children, babies to adults. That data is not available to us yet. So I encourage this committee to defer this bill and wait until the scientific data is out and let us all come to reason at that point. I don't know what the answers are. These very intelligent scientists, and mind you, I've been doing scientific research on sunscreens for 30 years as a practicing dermatologist. And so I ask the committee, please defer, wait for the science, don't get in front of it, and use your common sense and wait for the scientific evidence to come in. Again, I'm an avid waterman. I spend a lot of time in the ocean. I have a broken neck from the North Shore to prove it. And I will ask the committee to really use the guidance of the FDA and the National Academy of Sciences Subcommittee on Sunscreens to weigh in with their evidence forthcoming in the next few months. And then let's reconvene and let's take a look at the data. And then let's create some bills that make sense. In the meantime, let's not put human life at jeopardy.
Thank you very much, Dr. Martin. We also have Lisa Bishop, Friends of Hanauma Bay, in opposition.
Aloha Chair Johansson, Vice Chair Kitagawa, and CPC committee members. The weight of scientific evidence over the past 20 plus years recognizes that petrochemical UV filters in sunscreens pose a threat to corals and other marine wildlife, as well as public health. But HB 1519 as written is not the best vehicle to further mitigate these impacts to our marine environment. We therefore ask the committee to defer House Bill 1519 with sincere appreciation for being allowed to discuss these issues before the committee this year. Aloha.
Thank you, Lisa. We also have Ted Bolin with the Hawaii Reef and Ocean Coalition in opposition.
Thank you, Chair Johansson, Vice Chair Kitagawa, and members of the committee. I represent the Hawaii Reef and Ocean Coalition, which is a group that is concerned about protecting the reefs from various threats, including chemical sunscreens. We appreciate the intent of this bill, as well as the opportunity to testify, if the intent is to protect people from harmful sunscreen chemicals. We, however, must oppose the bill because we believe the approach, which is based on human health, fails to protect regarding the environmental impact on corals and marine life. Health is very important, of course, but so is the environment, and particularly coral reefs that protect our shoreline and have been called the rainforests of the ocean because of their productivity. It is very important that we protect those as well, and therefore High Rock must oppose this bill. Thank you for the opportunity to testify, and I would be available for questions if anybody were to have any. Thank you very much.
Thank you very much, Ted. Let's see. Is Dr. Dennis Dudley here? I believe he said he was not. Okay, in support. John Kawamoto in support. Hi, John, go ahead.
To testify. My name is John Kawamoto. Aloha. My name is John Kawamoto. Thanks to testify in support of the bill. It protects the public by preventing the distribution of sunscreens with ingredients that have not been determined to be safe and effective by the FDA. Thank you for the opportunity to testify.
Thank you very much, John. We also have Council Member Kelly King in support.
Aloha, can you hear me?
Yes, we can. Please proceed, Council Member.
For entertaining this bill, for hearing this bill. And I wrote in testimony in support of this bill, but I agree with Ted Bolin and Lisa Bishop that the bill is unclear. And I think the problem with it is its original intent. Both versions of this bill came out of the environmental committees in the Senate and the House, and they've somehow turned into human health issues rather than the intent to protect the marine ecosystem, which is what we looked at on Maui when we passed this in Maui County. And I understand the lobbyists wanting to get involved in the economic interests protecting, various types of sunscreens. We do have options. We have the mineral sunscreens, we have rash guards, we have hats, we have staying out of the sun if you are really susceptible to cancer. So we entertained all these options. We looked at these at the relevant research that did show a correlation between the health of the reef and sunscreen proliferation. And we partnered with Department of Land and Natural Resource on the bill that we passed in Maui, subsequent to which they installed 4 mineral sunscreen dispensers. So it's getting even easier to use these healthier sunscreens that are better for your body and better for the reef. But I do agree that the bill has kind of shifted into something else. The focus is less on the marine environment. And so I would concur with my fellow environmentalists that it might be a good idea to defer this and work on the language and get the focus really clear, because this is really important. This movement is in line with the state's support, Maui County's support of biodiversity when we signed the Edinburgh Declaration at COP26. And this is one of the areas that's key to our economy. This is why tourists come here. But I just want to add those additional comments because we've all been trying to support this bill, but as we move forward, we're realizing that, and we see that the opposition is coming from the human health side. We just feel like this bill is not clearly written as to its original intent. So thank you for the chance to testify. I'm happy to answer questions if you have any.
Thank you very much, Council Member. We also have Matthew Geyer in support.
I'll just stand on my testimony.
Okay, thank you. Members, please note on this measure, we have late testimony from the Retail Merchants of Hawaii in opposition. They are not here. Hawaii Food Industry Association in opposition.
Thank you, Chair. We'll mostly stand on our testimony, but we will agree with the other testifiers that we believe this bill should be held. And I did just want to read a quote from the FDA website. They are still, reviewing this process, and this bill is very much ahead of their findings. And their quote basically says, given the recognized public health benefits of sunscreen use, Americans should continue to use broad spectrum sunscreen with SPF or higher with other sun protective measures as their rulemaking effort moves forward, because it is actually not finalized. So with that, we will stand on the rest of our testimony. Thank you very much.
Thank you very much, Lauren. Do we have late individual testimony from Jessica Rosado in support? Jessica is not here. Members, please note that we have numerous testimonies in support and some opposition on HB 1519. Is there anyone else wishing to testify on HB 1519?
Yes, committee, if I may.
Please go ahead, Mr. Dean. I'm sorry about that.
Yeah, thank you very much. Just briefly, I'm a surfer. I spend like 3 to 5 hours in the ocean in one shot and surfing. I use a mineral-based sunscreen. It's very effective. It's as effective as any other chemical-based sunscreen. I haven't read the entirety of this bill, but I definitely support the intent of this bill. And if it needs to be reworked, then it should be reintroduced, in my opinion. Thank you.
Thank you very much, Mr. Dean. I appreciate it. Is there anyone else wishing to testify in HB 1519? Okay, seeing no further testifiers, then members, any questions on HB 1519? Representative Onishi.
Yeah, for the Department of Health. Is there a representative?
Hello, yes, Dr. Diana Felton, toxicologist for the Department of Health.
So there is testimony that says that since the, I believe 2018, I think, when we made some bans on sunscreen, there's been an increase in cases of skin cancer. Is that something you can verify?
I cannot verify that. I believe the testifier said increased cases of sunburn, not skin cancer, but I'm not certain of that. I do not have available data on reported skin cancer cases in Hawaii since 2019, but I can follow up for you and see if we can track down that information.
Okay, thank you. Thank you, Chair.
Thank you, Representative. Members, any other questions on HB 1519?
Mr. Chairman?
Representative Har.
Thank you, Mr. Chairman. Sorry, technical problems. Can I please have Department of Land and Natural Resources? I guess it's the Department of Aquatic Resources.
Yes.
Good afternoon, Mr. Sakota. Thank you for being here, for standing with us throughout the testimony. I'm looking at your written testimony and I'm trying to process it. And I think, is it really what you guys are essentially saying though, is that the FDA will create this definitive ruling, and until then, this bill is essentially it's premature, like some of the other testifiers have stated?
That's part of it. The other part is the determination of generally regarded as safe and effective is based on human health. And I don't believe they look at the effects on the environment, the coral reef. So the FDA could find that avobenzone or some of these other chemicals are completely safe and effective for human health, but they still, might have some adverse impacts on the marine environment. So there's no correlation with, linking the proposed chemicals to be banned with something the FDA comes out with if the intent is to protect the marine environment. So basically, we're saying if you want to prohibit certain chemicals, why don't you just name those chemicals? And we provided a list of chemicals that have some research at least showing that there's potential harm to the environment.
Okay, so that's what you're seeking then, is more of a definitive list as opposed to this broad brushstroke that this bill is intending to do.
Yes.
Okay, thank you very much. Thank you, Mr. Chairman.
Thank you, Representative. Members, any other questions?
Sure, I have a follow-up.
Representative Onishi.
Yeah, for Mr. Sakura, I have a question, in regards to the use of sunscreen. Do you know what percentage of sunscreen are used that are sold in Hawaii, or sold in Hawaii, I guess that's the only measure, is actually people who access the ocean, are used by people who access the ocean?
Yeah, I don't have that information, but I will add that I think there's evidence that the chemicals in these sunscreens do persist. So, it may not just be ocean users, but even people on land. If somehow they shower and it gets down through the wastewater systems to the ocean, that can continue to have impacts.
So it's your contention that wastewater treatment systems do not eliminate these toxic chemicals?
That's what some of the preliminary research has suggested.
Research by who?
We've cited a number of papers in our testimony. I can't name any of them offhand though, but I can get back to you on that.
Okay, so the information that you've come across, it says that toxic chemicals from waste treatment plants are being discharged into the ocean?
Yeah, and again, a lot of this is, pretty preliminary findings. Whether they're at levels that would affect the marine environment or what impacts those have is not conclusive yet, but the fact that some of these chemicals are getting into the ocean from land-based sources has been suggested.
Oh, suggested.
Yeah.
Okay.
The research is very preliminary.
Go ahead, Representative.
Okay, Department of Health. So would you also, I guess, agree that our wastewater treatment systems allow toxic chemicals into the ocean?
It's a nuanced question. There are definitely certain toxic chemicals that pass right through the wastewater treatment plants without being filtered out or changed and end up into the ocean. I am not exactly certain about these sunscreen chemicals. I do know that that oxybenzone and octinoxate, for example, do get metabolized through the body pretty much unchanged and end up in the urine. And so they do end up getting into the sewage system, even if people are using them and not getting into the ocean. But I am not fully certain of how much they are changed or processed at wastewater treatment plants. But other chemicals certainly do pass through without significant removal.
So would you have an estimate of how much sunscreen that is purchased in Hawaii is actually used by users who enter the ocean?
I do not have an estimate of that. We, as far as I'm aware, we do not keep careful records on even total amounts of sunscreen purchased. And further information of who's using it, how they're using it, and where they're using it is not being captured as far as I'm aware.
So we may not have a good balance between environmental impact and health impact.
I think that is the difficulty with some of these, considering some of these potential bans on sunscreen components, is trying to find that balance between environmental protection and then protection of the coral reefs and impact on humans from potential increased skin cancer.
Thank you. Appreciate that. Thank you, Chair.
Thank you, Representative. Members, any other questions on HB 1519? Okay, seeing none, then we'll move on to our next agenda item, HB 1809, relating to taxation. This establishes a renewable fuels production tax credit. On HB 1809, we have the Department of Taxation offering comments.
Thank you again, Chair, Vice Chair, members. The department will stand on its comments and happy to answer any questions. Thank you.
Thank you very much. Next, we have the Hawaii State Energy Office in support.
Aloha, Chair. This is Scott Glenn, Chief Energy Officer for the Hawaii State Energy Office. We submitted testimony in support with several amendments for your consideration in addressing ways to pursue the certification and verification. Chair, please excuse this comment out of order, but I'll be having to leave soon, so I won't be available for subsequent bills on the agenda. So I'd just like to note that we did submit testimony and stand on that testimony for those bills. Thank you.
Okay, thank you very much, Scott. We also have Tom Yamachika with the Tax Foundation of Hawaii. Not here. Henry Curtis, Life of the Land, offering comments. Not here. Robert King with Pacific Biodiesel Technologies in support.
Yes, Chair. This is Bob King from Pacific Biodiesel. I stand on our written testimony, and I am here available for questions if needed. Thank you.
Thank you very much. Do we have Mark Koppel in opposition? We do not. Let's see. We have late testimony from Hawaii Gas, Julie Unker in support. Not here. And Christopher Dean with Recycle Hawaii and Clean the Pacific in support.
Yes, committee. Thank you for taking my testimony. I am in support with the intent of this measure, but I would only request certain amendments be made to this bill because it is unclear about the carbon impact from the production of the energy that goes into producing these fuels. So, for example, we make ethanol with corn, but then now that's more carbon than gasoline. Like that is like a net loser because there's so much energy involved in producing the corn, for example. Hydrogen fuel, it's a great thing, except for it's all made from methane. So that's not a good fuel source. If you want to make, hydrogen fuel and you make it from methane, that's a major carbon source then. So I think that in like line 4 of section 1, subsection 4, that shows that the fuel has to be significantly low carbon compared to fossil fuels. Well, I would suggest amending this this bill so that it says the energy sources used to manufacture these biofuels are also low carbon or significantly low carbon generated from solar or wind. Like biofuels, particularly made from biomass plants, biomass generation, burning trees, pellets like that all is more carbon than burning coal. So if you use like biomass generation to make hydrogen, for example, all that electricity that goes to the process of making that hydrogen came from biomass generation using trees. That is a major carbon source. So then that would defeat the whole purpose. You might as well just use jet fuel. All right. Thank you very much.
Thank you very much, Mr. Dean. Members, please note that we have numerous other testimonies offered in support and offering comments. Is there anyone else wishing to testify in HB 1809? Okay, seeing no further testifiers, members, any questions? Okay, seeing no questions, then we'll move on to our next agenda item. HB 1811 relating to energy. This allows for new and upgraded electrical vehicle charging stations having a single port to qualify for a rebate. It eliminates the annual cap on rebates and it increases flexibility of the PUC to administer the electric vehicle charging station rebate program, increasing maximum percentage of rebate program appropriations that may be expended for admin costs, as well as marketing and outreach efforts. On HB 1811, I believe he has left us, but just in case, I will call Scott Glenn with the Hawaii State Energy Office in support. Next, we have Jay Griffin with the Hawaii Public Utilities Commission in support.
Aloha, Chair, Vice Chair, members. Michael Chapman on behalf of Chair Griffin. The Commission stands on its written testimony in support. Thank you.
Thank you very much, Michael. We also have Michael Munikata with Ulupono Initiative in support.
Good afternoon, Chair, Vice Chair, members of the committee. Michael Munikata on behalf of the Ulupono Initiative. We'll stand on our testimony in support. Thank you.
Thank you. We also have Sonia Cass with Kauai EV in support.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, and CPC committee members. Kauai EV stands on our written testimony in strong support of HB 1811 with comments. I would like to elaborate on our recommendation to not give the rebate for charging stations that exclude non-Tesla cars from charging. We are happy that Tesla chargers are included in the rebate, and we are aware that Tesla has done more to further clean transportation than all the other automakers combined. But the main necessity for public charging infrastructure is to allow people who can't charge at home to participate in clean and sustainable transportation. Many of them are renters and in a lower income bracket. Most of these people cannot afford a Tesla. Please make sure that these people are not excluded. Tesla has a pilot project that allows regular cars to use their chargers. A link to the article in my written testimony. We recommend to add language to make sure that this happens in Hawaii as well. Thank you for your time, and I'm available for questions.
Thank you very much, Sonia. We also have Tiffany Yajima with the Alliance for Automotive Innovation in support.
Good afternoon, Chair, Vice Chair, members of the committee. Tiffany Yajima for the Alliance for Automotive Innovation. We stand in our testimony in support. Thank you.
Thank you. We also have Dave Rolfe with the Hawaii Auto Dealers Association in support.
Chair Johansson, Vice Chair Kitagawa, and members of the committee, I'm David Rolfe with the Hawaii Automobile Dealers Association. We stand in support and are available for any questions.
Thank you very much, Dave. We also have Noreen Reimel with Hawaii Energy offering comments.
Aloha, thank you for this opportunity to testify on behalf of Hawaii Energy. We stand on our testimony with comments, and I'm available to answer questions.
Thank you very much. We also have Melissa Miyashiro with Blue Planet Foundation in support.
Good afternoon, Chair, Vice Chair, and committee members. Melissa Miyashiro with Blue Planet Foundation will stand on our testimony in support of this bill. Thank you.
Thank you very much, Melissa. We also have Sandy Wong with Tesla in support.
Yes, Chair, I'm here. So in the interest of time, Tesla will stand on its written testimony in support. I would just make one comment. Tesla cars range in price. It can be as low as $35,000. It can go higher. So it's very unfair for testifiers to say that Tesla is only for rich people, because that is not the case. Thank you.
Thank you for the clarification, Sandy. We also have John Kawamoto in support.
Thank you for this opportunity to testify. My name is John Kawamoto. The adoption of electric vehicles requires an infrastructure that includes charging stations.
John, I think we've lost you. We can't hear or see you anymore. You can see your name though.
Okay.
Oh, okay.
Sorry, I'm having technical problems, but you have my
No
testimony.
problem.
Thank you.
Thank you, and sorry about that. We also have Matthew Geyer in support.
Aloha, Chair Johansson, Vice Chair Kitagawa, members of the committee. Stand in support, and especially of removing the limit. A little bit concerned about how the rebate seems like it's being lowered, and the number of ports being allowed per station is changing. Not sure I understand the reasoning or the effects behind that, so I just caution there. Aloha.
Thank you very much, Matthew. We also have Patrick McCain with the Department of Transportation in support, offering late testimony. Not here. I've been informed that others who have said that they would testify are not present, but members, please note various supportive testimonies also proffered on HB 1811. Is there anyone else wishing to testify on HB 1811? Okay, seeing no further testifiers, members, any questions on HB 1811?
Chair?
Representative Onishi.
Yes, for the PUC, Mr. Griffin. So do you have data as to how much in, I guess the rebates have been issued?
So Hawaii Energy might be the best to ask about that. They administer the program itself. We did mention in our testimony, the program has included 43 rebates for new level 2 chargers, 62 for level 2 retrofits, 1 for DC fast chargers, and 1 for DC fast charger retrofit, as well as 30 projects in the pipeline.
Yeah, so with that information, do you know how much has been issued? Is this
I would
since the program-
defer to. Sorry, go ahead.
No, so this is since 2019
Correct.
up to 2021?
This is through January of this year, I believe.
So is it safe to say you haven't come near the 500,000 per year rebate limit?
Well, what I'll say is last year there was legislation that expanded the funding to the program. Additionally, this bill would expand eligibility to include single port chargers, and with the amendments from the previous committee to include chargers that serve one vehicle type. So this is something of an expansion of the program, which is why we find it appropriate that the cap would be lifted to accommodate that, so that if the funding is there, that it is able to be used rather than getting stuck in the special fund account.
Okay, thank you. Chair, if I
Please
might,
go ahead.
for Scott Glenn,
He's gone.
so
Yeah.
has he gone already?
Yeah.
Okay. Okay, thank you, Chair.
Thank you, Representative. Members, any additional questions on HB 1811? Okay, seeing no further questions, then we'll move on to HB 2278 relating to energy. This establishes a refundable income tax credit to mitigate the effect of a carbon emissions tax. And it amends the barrel tax to address carbon emissions. On HB 2278, we have the Department of Taxation.
Thank you again, Chair, Vice Chair members. Josh Muckles, Department of Tax. We'll stand on our testimony, offering comments. Happy to answer any questions. Thank you.
Thank you very much. Next, we have the Environmental Justice Task Force for Faith Action, Community Equity.
Yes.
Norman Chang.
Thank you. This is Susan. I'm the chair. Aloha, Chair Johansson, Vice Chair and committee members. Environmental Justice Task Force for Faith Action for Community Equity strongly supports HB 2278. 2278 can work in concert with climate change measures to decrease our carbon emissions. Our organization promotes legislation that will work to mitigate climate change and measures that protect and enhance social and economic equity, and HB 2278 fits the bill. Mahalo for hearing our testimony.
Thank you very much, Susan. We also have Micah Munekata from Ulupono Initiative in support.
Afternoon, Chair, Vice Chair members. Ulupono will stand on its testimony supporting this bill. We're very supportive of a carbon cashback policy here in the state of Hawaii. Thank you very much.
Thank you. We also have Dave Rolfe with the Hawaii Auto Dealers Association offering comments.
Chair, Vice Chair, HADA stands on its written comments in support, and I mean, actually written comments, but we will say in general, we're in support of this concept. We've issued only comments, but it will reduce climate emissions. And I think it's one of the best written bills I've seen toward moving things forward. So we're making a lot of comments on it, but we believe there's a lot of thought that's gone into this bill. Thanks for allowing us to testify.
Thank you very much, Dave. We also had Ted Kafalas with the Grassroots Institute of Hawaii offering comment.
Aloha, Chair, Vice Chair, and members of the committee. My name is Ted Kafalas. I'm the Director of Strategic Campaigns for the Grassroots Institute. While we appreciate the environmental goals that this bill seeks to achieve, we are concerned that the outlined proposal would not achieve its desired outcome. Many of the tax increases would simply be passed on to the consumers, and we feel that it would nullify the gains of a refundable income tax credit. Additionally, every business from doctor's offices to grocery stores would have to account for higher energy and fuel costs, translating into higher transportation and delivery costs that will result from this tax. As a result, we feel that businesses will be forced to raise prices accordingly, which could result in a drastic increase in Hawaii's cost of living. That's something we really can't afford at this time. In order to seriously help working families, we urge the committee to abandon the high tax approach that has helped drive up the cost of living in our state. Thank you for the opportunity. We appreciate the ability to testify that today.
Thank you very much, Ted. We also have Ted Bolin with Climate Protectors Hawaii in support.
Thank you, Chair, Vice Chair, members of the committee. The Climate Protectors of Hawaii like this bill very much. We think it's a good approach. It's a first step, but a good one. It would make the people who are polluting pay, and the rest of the people would prosper. The UHERO study, I think, indicates, contrary to what the last speaker said, that the most of the people would benefit from this bill with the refunds, most tax filers, that is. So we strongly support this bill, both as a matter of climate protection and a good bill in terms of how it is designed to help the people. Thank you very much for the opportunity to testify. Available for questions.
Thank you very much, Ted. We also have Paul Bernstein in support.
Hi, sorry for my inability to use my mouse.
No problem.
Aloha, Chair Johansson, Vice Chair Kitagawa, and committee members. Mahalo for hearing this bill. My name is Paul Bernstein, and I'm one of the co-authors of the two UHERO studies that found, as the last speaker, Mr. Bolin said, that actually all households for all quintiles on average would actually gain from this policy. So it is correct that prices would go up based on their fossil fuel content, but that's also the mechanism to help move people away from using fossil fuels. And the beauty of this bill, the carbon cashback bill, as Micah mentioned from Ulupono, is that it gives the money back to citizens. This, by doing so, it does benefit households. And if you look at the studies and what the Tax Review Commission showed, that, as I said, on average, households win out with this policy. Thank you again for letting me testify, and I'm available for questions.
Thank you very much, Paul. We also have John Kawamoto in support.
Oh, sorry for the technical glitch. Economists have called climate change the greatest market failure in history because the fossil fuel industry avoids paying for many of the costs associated with fossil fuels. Society as a whole pays for the harmful effects of climate change caused by the burning of fossil fuels. To reduce the consumption of fossil fuels, thousands of economists, including 28 Nobel laureate economists, have endorsed the common carbon fee and dividend model contained in this bill. It's good for the environment, it's good for us, it's good for future generations. Thank you for the opportunity to testify.
Thank you so much, John. Do we have Tan Kini in opposition? No, we do not. How about Carol Cam in support?
Good afternoon, Chair, Vice Chair, and members of the CPC committee. Mahalo for hearing this testimony. I am in support of the bill. Climate change has affected me in several ways. Elders have suffered severe dehydration. Students have suffered oppressive heat during school. Drought and wildfires have occurred more often. Nearby coral reefs have died. Storms have damaged electricity and communication infrastructure. Storm debris and coastal erosion have blocked highways, and goods and services have been interrupted. The reasons for my position on HB 2278 are Hawaii definitely needs effective climate action now, such as a progressive economic policy that also protects low and middle income households. Hawaii needs a strong strategy that will help us transition to cleaner energy and transportation. Hawaii can do that by putting a gradually rising tax on fossil fuels coming into our economy and passing along the collected money to our residents. Hawaii has the nation's highest electricity and natural gas rates. So Hawaii will continue to suffer from high energy prices if it depends on imported fossil fuels. Since 2020, a 67% increase in major US power outages was due to climate events that caused billions of dollars in damage. Rather than clean up disasters after they happen, Hawaii needs to forestall climate disasters. All of us need to quit using fossil fuels quickly. I believe carbon pricing can be very effective and fair in helping to do that. I urge you to pass HB 2278. Mahalo.
Thank you so much, Carol. We also have Matthew Geyer in support.
Aloha, Chair Johansson, Vice Chair Kitagawa, members of the committee. First, I'd like to apologize for my testimony on HB 1811. I misread the bill. I looked over it again and I realized I misunderstood it. So I'd like to withdraw my comments and again, apologize to the committee. But if there is one bill I do know, it's HB 2278. And this one is a really good bill. I'd like to echo out all those folks who have supported it so far with their beautiful testimony. And I'd like to also offer that this bill will in effect be a little bit of a green fee kind of that goes because visitors will come and will pay into this program, but residents will get paid out from it. So this is a way for Hawaii's residents to finally get a piece of the pie. So that's going to be really important, especially for low-income families and for all those people who've been suffering from the pandemic and lack of work. So please, strong support for HB 2278.
Thank you very much, Matthew. We also have late testimony from Noel Morin, Citizens Climate Lobby Hawaii, in support.
Good afternoon, Chair, Vice Chair, and members of the committee. Yes, I'm Noel Morin. I am the state coordinator for Citizens Climate Lobby Hawaii, representing 4 chapters across the state. A price on carbon pollution along with a refundable tax credit represent an effective and equitable approach to reducing emissions. We stand by our testimony in support of HB 2278. Thank you for this opportunity.
Thank you very much, Noel. We also have Douglas Hagan in support.
Hi, this is Doug Hagan. I'm a resident of Maui. I urge the committee's support of HB 2278. I want to highlight a couple things in my testimony. One, that in 2019, the Maui County Council passed 2 resolutions in support of carbon pricing, both at the state and national level. And I would like to highlight that it's not only a HERO study, but national studies, international studies shown effective carbon pricing. And one of the national studies did look at effects on specific breakout effects on Hawaii residents and came to similar conclusions that the UHERO that it's good for tax-paying families, up to 80% of the tax-paying families. So I strongly urge support for HB 278. Thank you.
Thank you very much, Doug. Members, please note that we have numerous other testimonies proffered from individuals and organizations in support of the measure, as well as providing comments. Is there anyone else wishing to testify in HB 2278?
Quickly, if I might, I know I didn't
go ahead,
submit
Mr.
prior.
Dean.
Yes, thank you. Thank you, committee. I would just like to say that Recycle Hawaii and Clean the Pacific supports this measure as well. Thank you very much.
Thank you very much, Christopher. Anyone else wishing to testify in HB 2278? Okay, seeing no further testifiers, then members, any questions?
Chair?
Representative Onishi.
Yeah, Chair, do we have someone from UHERO here?
I don't think so, but Paul Burns,
Yes.
I believe, wrote
Oh, okay.
the report.
Mr. Bernstein,
Yes.
so you're familiar with the study that UHERO did?
Yeah, I'm one of the co-authors. I'm a part-time employee with UHERO.
Okay, so the proposed taxes on a barrel of petroleum product was included in your study. Was there a effect on the cost of goods or the cost of living in Hawaii? Should this be put into effect?
Yes, it will raise the cost of goods and services, or goods and services that use fossil fuel directly or indirectly. So using electricity, using gasoline, natural gas. But as I said in the testimony, that's offset at an individual or household level with the dividend, hence the name carbon cashback.
Okay, so a family of 4, currently, what would be the increased cost of living by implementing this?
So in our, the first UHERO study we did, we found that a low income household in the, taking the carbon tax rate in this bill, so roughly in 2025, according to the rates in this bill, an average low income household would come out ahead, I believe, by about $900. And then, so that low income household, meaning the households in the lowest 20%. And then households in sort of the middle, call it the 60% or so, I believe, come out ahead by something like $500. And then the high income households, the top 20%, are basically flat. I think they came out ahead by $25 or something. I mean, again, it's the average household. So, you know, some will do better, some will do worse.
So a family of 4 in the low income area would come out $900 ahead. How is that possible? They wouldn't be paid, there would be no expenses to their.
No, the issue is with this bill, every adult gets back the same amount, whether independent of your income, whether you're wealthy or you're poor. Every adult gets the same income back, and in this bill, every minor gets back half a share. So in a low income household, just by definition of not having much income, you're not buying that many goods and services. So you're not putting that much money into the kitty, if you will, into the collection of carbon tax revenues. Whereas a wealthy person with a lot more money is buying a lot more goods and services, going out to eat more, has a bigger home, uses much more electricity, drives more, has more cars, etc., would be putting much more money into the pot, into the kitty. But everybody gets back the same amount, right? So just, you could say the wealthy person puts in 1,000, the low income person puts in 100. So we have $1,100 into the pot, but everybody gets the same amount back. So the low income person gets $550 back, the high income person gets $550 back. So the low income person is $450 ahead, and the high income person is, $450 behind.
So if I read this table correctly, and you said for 2025, for a couple filing jointly, they would get $180. So that's 360, and another half share for each child, which would bring it up to what is that? $560. But you said they would recoup $900.
So, sorry, let me just make sure we're looking at the same thing. You said 2025?
That's what you said, 2025.
Okay, so a couple things here. One is the tables, and I put this in my written testimony. The drafting of this bill, somehow something got messed up between the drafting and the current state of the bill. So the numbers in a couple of those tables are incorrect. So if you look there, if you take your example of a family of 4, in 2025, each adult would get $360 back, and each child would get back $180. So 360 twice is 720, plus another 360 is 1080. So the low income household would get 1080 back in your example, and would be paying in, far less than that in taxes. I'll also say that there's a difference here between using your example versus what we did in the UHERO study. In the UHERO study, we had 5 representative households, one for each quintile. So one for the lowest 20%, one for the next 20%, the next, so on. So we didn't actually have individuals in that. So need to be a little bit careful taking the numbers I'm saying out of the UHERO study and trying to use them here.
Well, a lot of people are using your study as part of their testimony. So I have a question. So those families, where were they located? Where did they live?
So in the UHERO study, they're just an average household. So I couldn't point you to any specific house. It's just taking what the average is for each of those income levels. So that's why I'm saying that, well, I'm not sure exactly where you're going here, but I'm guessing that if you look at certain households, you're right. Some are going to fare worse and some will fare better. If you take somebody who has a long commute with a car that is not very fuel efficient, they are not going to do as well with somebody who has a shorter or no commute and has a much higher fuel efficient vehicle.
Yeah, and as part of your testimony, you're saying that a lower income family, their cost of living is lower than a higher income family. Is that correct?
What I'm saying is that a lower income household, just by definition, will not be buying as many goods and services as a high income household. So on average, they're not going to be paying nearly as much in taxes as a high income household, because they simply don't have the money.
Okay, but that's depend on their consumption, right? I'm talking about cost of living. So a family, a low income family living in my district in Volcano, who has to commute daily to Hilo to work, which is 30 plus miles, right? They would be paying, and it's also been proven by the DOTAX study that was done on all registered vehicles in the state of Hawaii, that low income families generally have older cars that are less fuel efficient. So what you're telling me is that that family of 4 living in Volcano on low income, having to work in Hilo, that they would benefit by this program compared to a family of 4 who can afford a Tesla or an EV and travels to Hilo to work and pays no gas. Is that?
No, I guess that's why I'm trying to say that what the study looked at is an average household. So the average household is not the household in your district, right? The average household is all the low income households throughout the state. And just with the high income household, not every high income household owns a Tesla. So, I mean, I sympathize with you. You're right that there are folks that this policy, they may lose out with this policy. But on average, people will gain from this. And one of the reasons being is one of the testifiers brought up that we're charging the tourists for this and they're paying into this pot and they don't get any of the money back.
Well, the tourists don't pay my families in my district, in my rural district. And so you're asking me to support this, even though my low-income families in my district may get no benefit at all.
So let me put it, I guess the thing is, if we want to address carbon emissions, then that is going to require changes in behavior. And those changes in behavior will cost money. This is basically the only policy that compensates people or gives money back to people for reducing their emissions, and in general is a progressive policy. Many of the other policies out there, various mandates, subsidies, what have you, are regressive policies, and they are likely to be even worse for your constituents. So, I mean, I have a position that I would like us to address climate change. I'd like us to reduce emissions. And I think the most efficient, effective, and equitable way to do it is to correct the market failure and put a price on carbon. And then the equity part is to give the money back to individuals in equal shares, so it makes the policy quite progressive.
Okay, thank you, Chair.
Thank you, Representative. Members, any additional questions? Representative Har.
Thank you, Mr. Chairman. Mr. Bernstein, just while you're still here and on the hot seat. Thank you, Mr. Bernstein, for being here, and thank you for answering our questions and for testifying. You know, in your verbal testimony, you had indicated that, yes, in fact, this bill will raise costs for people, and it really is contingent upon their use of anything that is a derivative of fossil fuel, whether that be, energy fuel, whether that be gasoline. And I think what I'm hearing from Representative Onishi, in the same way, we represent communities that while you talk about goods and services as the low income family, theoretically, they don't have the income to be able to purchase goods and services. But I think the dispositive factor here is the fact who is utilizing, these fossil fuels or the fossil fuel derivatives. And that's who's essentially going to be hit most, from this particular tax. And, the tourist aside, I think we all agree that's fine. But the fact of the matter right now is that we have constituents who live for example, for me, living on the west side, who commute into town daily. And in the same thing, I have constituents, if they could do the right thing, if they could afford an EV, they would pay for it, but they can't afford it. And so unfortunately, they are relegated to having to utilize older cars that may not be as fossil fuel efficient. And so in that situation, it's very hard because they're dealing with the gas tax on the federal level. They're dealing with it at the state level and at the county level. And this bill does not repeal the gas tax. So then on top of it, they'd be dealing with, this carbon, I'm sorry, what exactly is exact? I want to make sure I'm using the exact word. The carbon fuel tax, or I'm sorry, what is it called?
carbon cashback or
The carbon
tax?
cashback tax, exactly. And then on top of it, one of the biggest concerns I have is I think the electric companies, they're one of the biggest emitters of CO2. And so I know they're just going to pass the cost along to the consumer if we do this, right? And so how does that benefit our constituents who are in that situation? And I know I'm talking a lot, but I want to give you an example. Years ago, when we passed when we gave the state tax credit on photovoltaic, we were criticized, and we were seen, in the state of Hawaii, it was like, no, this is really progressive. This is a good thing. We got to change here. We got to get people moving into solar. The problem was we were criticized because it was, well, a lot of people can't even afford to get those panels, so they can't even qualify for the solar rebate. And so we were really criticized, and it was like, once again, we're helping the rich people who can afford the solar panels. And so that's the conundrum that many of us are in. It's not that we don't want to do right by the environment. We just oftentimes can't afford to do right by the environment. And that's kind of, the conundrum that many of us legislators are in, because we know that our constituents are suffering. So how do we justify something like this? Because I'm not disagreeing with what you say with respect to low-income families having less disposable income, so theoretically they purchase less goods and services. But I don't think that's what this bill is contingent upon. It's really contingent upon the use of fossil fuels, the utilization of fossil fuel derivatives in your daily life, and that's really that's what the carbon cashback incentive is really going to be based upon. No, am I completely off base?
No, so I sympathize with all of you trying to work through this political process. No, so let me kind of go in a little bit reverse order here. Your solar volt, your PV subsidy, right? You're kind of making my argument for me.
Okay.
Because that is, just as you said, it's an extremely regressive policy. Who benefits from that? Well, it's the wealthy, the people who have a house and they can put it on there, right? They can put the PV panels on there. You're subsidizing them. You're giving money away that everybody puts in from their taxes, and you're giving it to the wealthy, basically. This bill is exactly for the largest purpose, it's basically the opposite of that. So I agree that there are low-income households. It is certainly true that lower income households have lower efficiency vehicles, and unfortunately many of them, probably have longer commutes, or some have longer commutes. But the high-income households have much larger houses, and not all of them have PV panels, and not all of them have electric vehicles. And many of them go out to eat all the time. They're driving long distances, they're traveling, what have you. So on average, they're going to be putting more money into this carbon tax revenue pot than low-income households. And the money goes back equally though, right? It doesn't matter, you or I, we all get the same amount back. And you are correct that it is dependent on your behavior at the end of the day, what your net is, right? If I circle the island every day, 2 or 3 times, and you just stay in your home, right? I'm going to be putting a lot of money in. I'm not, I get the same amount back, but I'm going to be losing, whereas you're going to be winning, right? So this policy, I would say, is not the end all be all. We need more than this. We need more to help our low-income communities, right? To help with this transition to a cleaner economy. It's just that this policy, I think, is an effective, efficient, and an equitable step to help us do that. Because there's actually money that's given to these low-income people. So we could we could mandate, okay, electric company, no more fossil fuels tomorrow, okay? Our electricity rates will go through the roof, right? But there's no money in that in that case. There is absolutely no money to be distributed to low-income people. Whereas this policy is actually reducing emissions, and there is money to be given back to low-income people. You know, unfortunately, it will not make all low-income people whole. That is certainly true. Both you and the other gentleman gave good examples of probably households that it won't. But it will certainly, well, almost certainly do better than many other policies, such as rooftop PV, subsidizing that, right? So anyways, I mean,
you in an awkward, yeah, again, I think the thing for me, when you say equitable, I understand how you're defining equitable in terms of it going back to everyone who puts into, you know, their utilization. But I think from, you know, my perspective with respect to equitable for those people who are in that situation, who are utilizing, you know, those cars and having longer commutes. And I think, you know, one of the interesting facts here in the state of Hawaii is we are very different in the sense where on the mainland, those who are those who are socioeconomically disadvantaged often live in the urban core, whereas those who are, you know, who are from, you know, an advantaged, you know, background usually live out in the suburbs. So it's a very different situation. So I've always, you know, toll roads, all those kinds of things. And so it's not always applicable here. So when you say that those who come from, you know, wealthier households, you know, have to drive far to eat, I don't necessarily subscribe to that because I think a lot of things are in the urban core, and again, representing a community that's, you know, on the west side. But again, I really appreciate you explaining this to me because, you know, I agree with you. We do have to find some, this is maybe just one tool. I agree with you. It's not the end all be all. I would submit it's not necessarily equitable, but from your point of view, I absolutely understand why you're contending that it is. So thank you so much for your testimony. Mr. Chairman, I'm sorry, if I may, is the Tax Foundation still here?
They were never here.
They were never here. Okay,
Showing
thank
up
you,
today.
Mr. Chairman.
Yep. Thank you, Representative. Members, any additional questions on HB 2278? Okay, seeing no further questions, then thank you, members, for the robust discussion. Thank you, Dr. Bernstein, also for your insights. Next, we have HB 2399 relating to waste management. This establishes an extended producer responsibility program. On HB 2399, we have the Department of Health in support.
Good evening, Chair Johansson, Vice Chair Kitagawa. My name is Michael Burke. I'm with the Department of Health's Office of Solid Waste Management. We submitted written testimony in support of HB 2399, and we stand on that written testimony. I'm here for questions after. Thank you.
Thank you very much, Michael. We also have Matt Sujimura with the American Beverage Association in opposition.
Aloha, Chair, members of the committee, Matt Sujimura on behalf of the American Beverage Association. You have our written testimony in opposition, but I just want to reiterate that HB 2399 HD1 states that the purpose is to establish an EPR program. However, an EPR program typically has an oversight body ensuring that appropriate use of the funds and evaluating metrics for success and things like that. And that is not evident within HB 2399. So really HB 2399 HD1 doesn't actually create an EPR program. What it really does in effect is to tax certain large corporations and provide essentially what would be a blank check to counties to develop their own needs assessments to reduce packaging waste. And so we do believe that there are better vehicles and better language with regards to an EPR program, such as HB 1684. But we look forward to continuing the discussion about EPRs, but we will stand in opposition to this and happy to answer any questions.
Thank you very much, Matt. We also have Ted Bolin with the Hawaii Reef and Ocean Coalition in support.
Thank you, Chair. Thank you, Vice Chair, members of the committee. This bill is a good first step toward extended producer responsibility. Extended producer responsibility is the notion that the producers of packaging are in the best position to decide how to make packaging more efficient and use less waste. We have a linear system now where we buy packages, we use the goods, and we burn all the waste or landfill it, and there's no efficiency there. We need to get to a system of waste that is not so wasteful. And that would require a system where the producers have some responsibility. This bill is great because it gives them, it starts down the road toward that. and it collects some fees from very large producers to get the process started. Right now, the counties are the ones who get stuck, and the taxpayers of the counties are the ones who get stuck with the bill for this inefficient waste system. We need to move away from that to reduce taxes and to reduce the environmental harm of waste. The Hawaii Reef and Ocean Coalition is very supportive of this bill. Thank you very much for the opportunity to testify.
Thank you very much, Ted. We also have Christopher Dean, Recycle Hawaii, in support.
Thank you, committee members. I really appreciate all the long hours and hard work you guys put in. Of course, we support this bill. We wrote the bill, so we definitely support it. I would like to point out something, though, besides my written testimony, which is that, you know, it's not just about preventing pollution. And it's not just about filling up our landfills with waste. It's about stopping the exploitation of our natural world. That's the #1 killer right there. And I would give all of the representatives tonight a little fun homework assignment. If you go home and turn on your computers, and I know maybe you want to do it tomorrow or something, you've had enough, but you go home, turn on your computers, look at Google Earth satellite view, and look at the United States of America so you can see the entirety of the United States of America. Everywhere where it's light green or tan or gray, that's land that has been completely exploited by humanity. Only the dark green areas are forest. And when you zoom in on those forest areas, you're gonna see that they are not forests, that there's houses, roads, there's all kinds of human activity and development. They're being logged, there's plant. The point is, just like Ted Boland was saying, we can no longer continue to live in a linear fashion. We live on a sphere, it's not getting any bigger. We can't just keep on extracting from nature and throwing it away. If we don't close this loop soon, it's going to be real trouble, real pain and suffering. So thank you very much for your support for this bill. Appreciate it.
Thank you very much, Christopher. We also have Louis Salaveria with the Wine Institute in opposition.
Good afternoon, Chair, Vice Chair, members of the committee. Louis Salaveria on behalf of the Wine Commission. You have our testimony in opposition, and although laudable, we do believe that the bill as written is premature, as it establishes through session laws and not through statute, temporary tax via the establishment of a special fund that at this point in time, we really don't feel that it meets the requirements of HRS 3752.3. So with that, thank you for the opportunity to testify. Happy to answer any questions. Thank you.
Thank you, Louis. We also have Jennifer Navarro with Zero Waste Hawaii Island in support.
Hi, thank you. Thank you, Chair Johnson. I was involved with drafting this bill. I worked with a working group. We had representatives from the county, environmental organizations, as well as some businesses. And I've also been interacting and working a lot with local businesses. And a lot of them want to provide their customers with sustainable packaging solutions. But it's really difficult because these large producers really drive the options that businesses have. And it costs a lot to provide it costs businesses more on their already thin profit margins to provide these sustainable options. And so the idea behind this bill is just a very cautious, moderate first step. We are only taking money from top producers. And then we're going to take that money and we're going to put it towards getting the infrastructure in place to create reusable packaging systems. This is a unique bill. No one else has introduced an APR bill like this because we are out in the middle of the ocean. And so in order to, recycling doesn't really make a lot of sense in Hawaii, and it's also not the most sustainable system. So right now there is a push in the zero waste movement towards reusable packaging systems. And so this money that we would collect from top producers will be put towards putting in place the infrastructure to transition to reusable packaging systems in Hawaii that in the long run is going to be good for the planet. It's going to be good for our local businesses. It's going to create new jobs, new green jobs, high-tech jobs for tracking of packaging. And I stand on my written testimony. I put a lot in there. So if you just would read that over, this would be a good thing, not only for the planet as a whole, but for our islands. As you know, all of our landfills are, Kauai and Oahu, their landfills are closing. Our landfill on Hilo, on the Hawaii island, is now closed. All of our waste needs to be trucked. So we need to deal with packaging waste. And this bill is a first step to transition to a new system, a circular system for packaging. Thank you.
Thank you very much, Jennifer. We also have John Kawamoto in support.
Thank you for the opportunity to testify. My name is John Kawamoto. The earth is being overwhelmed by waste, and much of it is packaging material. This bill makes the producers of high volume products responsible for the packaging.
We've lost your audio again, John, and your visual.
Sorry about that, but you have my testimony, so thank you very much.
Okay, in support. Thank you, John. We also have Matthew Geyer in support.
Aloha, Chair, members of the committee. It's getting late. I'll just stand on my testimony in strong support.
Thank you very much. We also have late testimony from the Hawaii Food Industry Association in opposition.
Thank you, Chair. I will stand on my testimony, but I will also note that right now in Hawaii, we have a really serious problem with supply chain. I'm sure you've gone to the grocery stores, you've seen the empty shelves. This is not really the best time to be disincentivizing the largest producers of food from sending products to Hawaii. We did participate in the plastic source reduction working group, and one of the recommendations of that working group was to undertake a fair and careful study of extended producer responsibility. So we believe that would be the next best step to take right now, and just caution against worsening our current supply chain crisis that's happening right now with grocery stores. So thank you very much for the opportunity to testify.
Thank you, Lauren. Members, please note we have numerous other testimonies proffered in support. And comments on this measure. Is there anyone else wishing to testify on HB 2399? Okay, seeing no further testifiers, members, any questions?
Mr. Chairman, I'm sorry.
Representative Har.
No, it's late. I just have really two quick questions. I think Matt Sujimura, are you still there?
Yes, Chair.
American
Yes, ma'am.
Beverage.
I'm here.
Okay, very quickly. So I saw the written testimony, but the question that I have is, you're contending the HD1 version of this bill does not in fact have an EPR program?
Yes, well, the bill itself, yes.
Okay, so that's one of the issues. That's one of the biggest issues you guys have with this measure, with the HD1?
Yes, primarily because of the lack of oversight.
Got it. Okay, thank you very much. And Hawaii Food Industry Association, Mr. Bell.
Hi.
Good afternoon, Mr. Bell. Thank you for being here with us in this late hour. Very quickly, I want to get to this plastic source reduction working group that was convened in 2020 and that was comprised of numerous stakeholders. So basically, you say that the findings of the task force essentially were to analyze specific scenarios. Okay.
So, but yeah, basically the study should analyze the following two specific scenarios. Number one, EPR in Hawaii independent of other state and federal packaging EPR initiatives, and two, packaging EPR in Hawaii in conjunction with or synchronicity with other state and federal initiatives, and that the study should evaluate the best science available, the cost and benefit to all stakeholders, and the pros and cons, as well as the feasibility.
Okay, so these are the recommendations from the working group?
Yeah, and that included a lot of environmental and government representatives.
Okay, great. Thank you very much, Mr. Bell. Thank you, Mr. Chairman.
Thank you, Representative. Members, any additional questions on HB 2399? Okay, seeing no further questions, then we'll move on to our last agenda item, HB 2493, relating to carbon sequestration initiatives. This establishes the Hawaii Farmland and Forest Soil Health Carbon Smart Incentive Program to incentivize carbon sequestration activities through incentives contracts that provide for compensation for eligible practices by program participants. On HB 2493, we have the Department of Agriculture with comments.
Good afternoon, Chair Johansson. The department will stand on comments in the interest of time. Thank you.
Thank you very much, Morris.
Bill. Question.
Okay, excuse me. Thank you. Next, we have Office of Planning and Sustainable Development, Danielle Bass. Not with us, offering comments. Next, we have Gwen Yamamoto Lau with the Hawaii Green Infrastructure Authority in support.
Good evening, Chair, Vice Chair, and members of the committee. The authority stands on its written testimony in support with comments. Thank you.
Thank you, Gwen. We also have Marigold Zoll, DLNR, in support. Where is she? Oh,
sorry. Aloha.
Okay.
Leah Laramie with the Department of Land and Natural Resources, standing in for Marigold Soul. We are standing on our testimony with support with comments. Mahalo.
Okay, thank you. We also have, that's it for DLNR. We have Ted Bolin with the Climate Protectors of Hawaii in support.
Thank you, Chair, Vice Chair, members of the committee. Thank you especially for staying late, hanging in here. Really appreciate your hearing all these bills. I will stand on my written testimony too, except to say that we really need to do carbon sequestration in order to achieve carbon negativity in Hawaii. Reducing emissions is great. We got to do it, but we also have to work on sequestration. This bill is a good first step toward doing that. The Climate Protectors Hawaii strongly support this bill. Thank you for the opportunity to testify.
Thank you very much. We also have Brian Miyamoto with the Hawaii Farm Bureau in support.
Good evening, Chair, Vice Chair, members of the committee. Brian Miyamoto here on behalf of the Hawaii Farm Bureau. You have our written testimony in support, and we'll stand on that. We just wanted to highlight one part that we do have in our testimony that, again, based on the land use, planning, and management expertise, relationship with other agencies, previous work, and strong work record supporting greenhouse and gas sequestration. We do agree with OPSD's testimony in the previous committee that we do ask the legislature to consider them as a coordinating agency of this proposed program, but we do support this measure. Thank you, Chair.
Thank you. We also have Julie Unker with Hawaii Gas in support. Is not here. John Kawamoto in support. Hi, John, go ahead.
My name is John Kawamoto. Sorry for the technical difficulties. Carbon sequestration and reducing carbon emissions go hand in hand. Both must be done to mitigate climate change, to make the earth livable for future generations. Thank you.
Thank you, John. We also have Matthew Geyer in support.
Stand on my testimony. Thank you.
Thank you. Members, please note that there are additional testimonies proffered in support of this measure as well as comments. Is there anyone else wishing to testify on HB 2493? Okay, seeing no further testifiers, members, any questions on HB 2493? Okay, seeing no further questions, before we recess for decision making, I just wanted to thank all of our testifiers for hanging around with us and participating in democracy. I realize this is a long hearing, but these are important bills, and I just wanted to especially express the committee's appreciation to you for being a part of it, as well as my thanks to the members. So with that, we will recess for decision making. Recess. Reconvening our 2 p.m. agenda this February 15th for the Consumer Protection and Commerce Committee for decision-making. Again, my thanks to everybody for hanging around with us and my thanks to the members for their patience. First off, on HB 1432 relating to concessions on public property, the recommendation here is to pass this measure with amendments. I'd like to blank out the number of years. I'm not sure if 25 is best. I'd like to note in the committee report that the reason for blanking out the number of years for the extension beyond 15 is to engender further discussion about what is the most appropriate number to incentivize investment by the concessionaire, but also not stifle competition. I'd like to insert a defective date of January 1, 2050. And for anyone joining us, the reason for the insertion of a defective date is to ensure that we have to continue to discuss this more and the bill cannot just advance irrespective of the issues that need to be worked out. With that, members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1432 with amendment. Chair and Vice Chair vote aye. Representative Aquino is excused. Representative Har.
Aye.
Representative Hashem is excused. Representative Kong.
Aye.
Representative Mizuno is excused. Representative Morikawa.
Aye.
Representative Onishi.
Aye.
Representative Tarnas.
Aye.
Representative Matsumoto.
Aye.
Chair, your recommendation is adopted.
Thank you, members. On HB 1434, next relating to the counties, the recommendation here is to pass with amendments, just inserting a defective date of January 1, 2050 to encourage further discussion on this measure. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1434 with amendments, noting the excused absences of Representatives Aquino, Hashem, and Mizuno, who will be noted excused for the rest of today's agenda. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next, members, on HB 1568 relating to agriculture. On this, the recommendation is to make various technical and non-substantive amendments. I also do share some of the concerns about the adequacy of supply. I'd like to note in the committee report UH's specific concerns so as to flag and other departments so as to flag for this measure specifically that we may need to consider the practicality of such imposition of benchmarks. I do think it's a great underlying intention, which is why I would like to continue to keep the bill moving. So the simple amendment here will be just to make various technical and non-substantive amendments. Members, any comments or questions on the recommendation?
Chair.
Representative Onishi.
Yes, I have similar concerns about the UH system being included and the impact that Department of Health would have in terms of the overall issue. And I also have some concerns about public safety, who has 2 facilities that grow their own food, and whether or not that would count towards the goals and the requirements stated in this bill. So with that, I'll be voting with reservation.
Thank you, Representative Onishi. Representative Har.
Thank you, Mr. Chairman. Thank you so much for the recommendation and for the notes that you'll be putting into the committee report. I respectfully have the same concerns that were just raised by the previous speaker. So respectfully, Mr. Chairman, I'll be voting with reservations.
Thank you, Representative Har. Members, any other comments or questions? Okay, seeing none, thank you. Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1568 HD1 with amendments, noting the reservations of Representatives Har and Onishi. Are there any additional reservations? Representative Kong. Any noes? Chair, your recommendation is adopted.
Thank you, members. Next on HB 1830 relating to state self-insurance against property and casualty risks. The recommendation here is to pass this measure as is, so without amendments. Members, any comments or questions on the recommendation? Okay, thank you. Seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1830 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members. Next on HB 1908 relating to procurement with the GBR Committee Chair McKelvey's concurrence, I'd like to make the Contractors Licensing Board their amendment to add further clarity, as well as various technical and non-substantive amendments. I'd also like to note in the committee report that I think this is a good discussion ensuing between the general contractors and the subcontractors over what seems to be, at least for my time here, a perennial procurement issue. So with that, members, HB 1908 with amendments. Any comments or questions on the recommendation? Representative Har.
Thank you, Mr. Chairman. Thank you so much for the recommendation. I do have some concerns about with respect to the testimony that was raised by the painters having the two different sections in statute. I think that it could potentially be seen as conflicting, having it in two different sections of the statute. I agree with you wholeheartedly, however, but respectfully, I will be voting with reservations.
Thank you, Representative. Members, any other comments or questions on the recommendation? Okay, if none, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1908 HD1 with amendments, noting the reservations of Representative Har. Are there any additional reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members. Next on HB 1679 relating to acupuncture. Here with the concurrence of the Health, Human Services and Homelessness Chair, I'd like to make the Board of Acupuncture's amendments, which include changing the date of implementation to 2025 instead of 2023 as currently contained in the bill. Also including, they asked for random audit inspection provisions and CPR certifications. In addition to some changes they make in the reciprocity amendment language, but I think it'll better effectuate the intent of the introducers in the acupuncture industry. In addition to the Board of Acupuncture's amendments, I'd also like to strike the reference to internal medicine training, as that seems to be a point of contention between the medical profession or some in the medical profession. And I'd like to make various technical and non-substantive amendments for drafting consistency. Members, any comments or questions on the recommendation? Okay, thank you. Seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1679 HD1 with amendments. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you, members. Next on HB 1823 relating to health, the recommendation is to pass this measure as is. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1823 HD1 as is. Are there any reservations?
Reservations, please.
Representative Har, reservations? Any additional reservations?
Reservations, Matsumoto.
Reservations, Matsumoto. Any other reservations? Are there any noes? Representative Kong, no, and myself, no. Any other noes? Chair, your recommendation is adopted.
Thank you very much, members. Next on HB 1977 relating to dental health dental assistance. The recommendation here is to pass with amendments, taking up the Hawaii Oral Health Coalition's amendments here. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1977 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members. Next on HB 1980 relating to telephonic services, the recommendation here with the concurrence, all of these have been made with the concurrence of their respective chair, including the last one. HB 1980, the recommendation here is to adopt the insurance commissioner's clarifying amendments as well as technical and non-substantive amendments with the concurrence of the Health and Human Services and Homelessness Chair. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1980 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next, members, on HB 2260 relating to cannabis. The recommendation here is to pass this measure as is. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 2260 HD1 as is. Are there any reservations?
Reservations, please.
Reservations for Representative Har. Any additional reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next, members, HB 1971 relating to peer-to-peer car sharing. With the Transportation Committee Chair's concurrence, I will recommend the following amendments. And I do want to say, before I make the amendments, though, that I think what is so helpful about this discussion and the heart of the issue here is sort of what a peer-to-peer car sharing platform is most analogous to, whether it's a rental car or in a previous bill, we had discussion of whether or not it was analogous to a TNC. And I think that is the heart of the matter and a very good discussion to keep having and unresolved at the present moment, or whether it's analogous to just a regular passenger car. So recommendation on HB 1971 is to pass with amendments, including the restoration of the exemption for vicarious liability, which parallels the exemption that rental cars currently have. I do want to keep in what is in this current bill in its insurance requirements, because it's slightly different from what we passed in 1619. And I think that engenders a good discussion. And I want to have that clash to figure out what are the right insurance requirements. I'd also like to note in the committee report that if these peer-to-peer car sharing platforms are operating at the airport, that they must abide by DOT rules. I do want to note in the committee report also the feasibility and workability issues that may surround some of our recall provisions that are currently in this bill, as well as making various technical and non-substantive amendments. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1971 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next, members, on HB 1519 relating to sunscreens. I think great discussion here. And as we started to see through the discussion, there's a confluence of various stakeholders who come at this issue from different perspectives, but many share the same sort of opinion that perhaps this bill is not right. So whether it is some of our reef protectors and reef advocates and environmentalists, or consumer product stakeholders, dermatologists, and other healthcare professionals, I think an emerging consensus is that HB 1519 in its present incarnation just may not be the right vehicle to achieve all the ends that everyone is trying to achieve. So because of that confluence in opinions and requests to have this measure deferred, the recommendation here is to defer HB 1519. Members, next on HB 1809 relating to taxation, the recommendation here is to take the Department of Taxation's amendment. Sorry, this is relating to taxation and the renewable fuels production tax credit. Recommendation here is to pass with amendments to take the Department of Taxation's amendments to disallow multiple claims of the credit by related entities. Members, any comments or questions on the recommendation?
Mr. Chairman?
Representative Har.
Thank you so much for the recommendation. Mr. Chairman, some of the testifiers I thought were very compelling with respect to the type of renewable fuels that would be produced, because in the process, you have to look at exactly how much carbon they're emitting. And so I actually thought that that was actually very on point with respect to the type of fuels that will be produced and the process in it. So I do appreciate the recommendation of moving this bill forward. I think it's a laudable bill, but respectful, I'll be voting with reservations.
Thank you, Representative Har. Members, any other questions or on the recommendation or comments on HB 1809? Okay, seeing none then, thank you. Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1809 HD1 with amendments, noting the reservations of Representative Har. Are there any additional reservations? Any noes? No vote for Representative Kong. Any additional noes? Chair, your recommendation is adopted.
Thank you. Next, members, on HB 1811 relating to energy. This is related to our electrification and charging infrastructure. The recommendation here is to pass this measure simply with some technical and non-substantive drafting amendments recommended by our drafting agency. Members, any comments or questions on the recommendation for HB 1811? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1811 HD1 with amendments. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next, members on HB 2278. This is creating the refundable income tax credit to mitigate the effect of carbon emissions tax. I think we had a lot of great discussion here. And, I do want to note that while I think this is a broad-based and potentially beneficial program to many people, I don't know that universally it accommodates everyone. I do want to be sensitive, particularly to rural low-income families. This may be applied differently in the urban and suburban areas. So I do want to note that because that was part of the discussion, but I do think there are broader goals here, and I share Dr. Bernstein's contention that this is one of the policies helpful to supporting our environmental goals, but also may not necessarily come exclusively through punitive means, particularly to low and middle income people, because there's a specific offset for that. So it's for those reasons that I recommend passing HB 2278 as is. Members, any comments or questions on the recommendation? Representative Onishi.
Yes, I have real concerns over this concept, especially since I represent a very rural, low to moderate income district. I would like to have seen more detail and more study in the actual effect on families in various types of scenarios and what exactly is their benefit. And, I understand fully the concept that this is broad-based, but, again, for those that are in my district who are facing hardship, I do not see how this benefits them. And they'll be paying the costs to support other people who have the means to, I guess, benefit from this because of their, the circumstances in terms of the cost of living and their ability to pay for, whatever amenities that they wish. So with that, I cannot support this bill and will be voting no.
I understand. Thank you, Representative. Members, any other comments or questions? Representative Har.
Thank you, Mr. Chairman. I echo many of the comments from the previous speaker. I think the discussion was absolutely robust with respect to Dr. Bernstein's comments, but I think and I'm not going to contend that it's fundamentally flawed, but the fact that he contended that those who are of lower income, it was really based on the consumption of goods and services. And I would not contend that that is what makes somebody lower income. So again, I think, for many of the same reasons that the previous speaker just argued, I would, very much, I have the same concerns. I think, many of our families are suffering right now and they want to do right by the environment. They just can't afford to do it. And this would absolutely hurt them. And so respectfully, Mr. Chairman, I will be voting no.
Thank you, Representative Har. Members, any other comments or questions? Okay, if not, then seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 2278 HD1 as is. Are there any reservations? Noting the no votes of Representatives Har and Onishi, are there any additional noes? Representative Hong.
Sorry, reservation for Matsumoto, please.
Reservations for Matsumoto. So I have reservations for Matsumoto and no votes for Har, Kong, and Onishi. Any additional that I missed? Okay, Chair, your recommendation is adopted.
Thank you, members. Next on HB 2399 relating to waste management. I think this is a good aspirational concept. I do want to note in our committee report that there are concerns about exacerbating the supply chain issues. Just this bill timed at the present moment, but I do think it's a good discussion to continue to have. And as the Senate bill is not moving, I would like to keep this alive to continue this discussion. So the recommendation for HB 2399 is to pass this measure as is. Members, any comments or questions on the recommendation?
I'm sorry, Mr. Chairman.
Representative Har.
Thank you, Mr. Chairman. Thank you so much for the recommendation. I do have some concerns with respect to the working group that the Food Association had talked about. It was comprised of stakeholders, including environmentalists, and I think the recommendations that came out of that working group don't necessarily reflect this bill. So respectfully, Mr. Chairman, I'll be voting with reservations.
Thank you, Representative Har. Members, any other comments?
Chair, I have the same request.
Okay. Thank you, Representative Onishi. Members, any other comments?
I'll just be going with reservations, Chair. Thank you.
Okay, thank you, Representative Morikawa.
Has reservations as well, but I can wait to vote.
Thank
Sorry.
you, Representative Matsumoto. Okay. Seeing no further comments or questions, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 2399 HD1 as is, noting the reservations of Representatives Har, Morikawa, Onishi, and Matsumoto. Are there any additional reservations? Are there any no votes? Representative Pong is a no. Chair, your recommendation is adopted.
Thank you, members. Next and lastly, on HB 2493 relating to carbon sequestration initiatives, the recommendation here is to pass with amendments, including the Hawaii Green Infrastructure Authority's amendments, as well as noting in the committee report that the Office of Planning and Sustainability Development's Greenhouse Gas Sequestration Task Force may be the more appropriate entity rather than the Infrastructure Authority to potentially administer this carbon sequestration initiative should it continue to move on. Members, any comments or questions on the recommendation? Okay, thank you. Seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 2493 HD1 with amendments. Are there any reservations? Representative Pong. Any additional reservations? Any no's? Chair, your recommendation is adopted.
Okay, thank you, members, and thank you to the public. This agenda and meeting is adjourned.